Honourable members, the Deputy Speaker.
And are there any constituency statements by honourable members? And I give the call to the member for Mackellar.
Thank you, Deputy Speaker. Yesterday marked the launch of the UN's 16 Days of Activism Against Gender-Based Violence. In Australia, in 2024, a woman was killed every 4 days, and intimate partner violence contributes to more death and disability in women aged 25 to 44 than any other preventable cause. This is simply astounding. And these are not just numbers, they are lives cut short. And the ongoing ramifications of domestic and family violence are devastating. It rips families apart, and the ripple effect on our society is endlessly damaging. In 2024, in my electorate on the northern beaches of Sydney, we had the second highest increased rate of domestic violence-related assaults in New South Wales. And these are only the reported cases. This underscores the urgent need for government investment in prevention, culture change and more support and accommodation services, including in Mackellar. And the recent shocking Guardian investigation into the response of Queensland Police in the deaths of 3 women in that state lays bare just how much work there is still to go on changing the culture around domestic and family violence in this country, especially for our frontline responders. In Mackellar, the Northern Beaches Domestic Violence Network brings together local providers and community organisations to support victim survivors of domestic and family violence. On behalf of the Northern Beaches community, I extend the most enormous and heartfelt thank you for your tireless care and compassion. These organisations include the Zonta Club, the Women's Resilience Centre, Lifeline Northern Beaches, Moana Safe Space and the Northern Beaches Council. Other key members of the Northern Beaches Women's Shelter and Women and Children First are trusted specialist providers for crisis accommodation for mothers and children fleeing violence. These charitable organisations have delivered thousands of nights of safety and support to those in need. And yet, on average, both organisations turn away between 40 and 50 families a month due to a lack of capacity. And the wait for social housing for families in New South Wales can extend to 10 years. Despite this, there are only 10 government-funded crisis rooms available for women and children escaping domestic violence across the Northern Beaches, and none at all suitable for mothers with boys over 12. Speaker, for many women and children, sadly, the approaching holiday season does not bring a sense of joy and relief. It brings a heightened sense of fear and risk of abuse. The wish for many women and children this Christmas is simply to be safe from harm, and that if they do reach out for help, it will be there. Quite frankly, it does not seem like much to ask. Thank you.
Thank you, and I give the call to the member for Gorton.
Thank you, Deputy Speaker. I rise today to honour Emily Attard, a Caroline Springs local and founder and managing director of Specialist Hoops, a truly transformative basketball program operating across several locations in Melbourne's western suburbs. What began in 2017, when Emily was only 16 years old, has grown 8 years later into a vibrant community that bridges the gap in inclusion for people with physical and intellectual disabilities. As a young referee, Emily witnessed firsthand the barriers faced by children with disability, unable to play a full game due to a lack of inclusive opportunities and facing pushback on playing while wearing noise-cancelling headphones. Motivated by what she witnessed in a game she loved, she founded Specialist Hoops to create a safe space, not just for children, but for adults too, to play sport, to belong and to grow. But more importantly, Specialist Hoops has matured into a community, a place where participants can develop skills, but also friendships, self-confidence and a strong sense of belonging. Emily's vision doesn't stop at inclusion for its own sake. She's created pathways for higher performance too, with some Specialist Hoops players now training weekly for state-level tryouts and others now in mainstream basketball teams. What Emily has built is a powerful example of grassroots leadership, identifying a need, building a solution and growing something that matters deeply. Her work ensures that no one is left behind, not just in sport, but in community. I congratulate Emily Attard, her team, her volunteers and the Specialist Hoops community for 8 years of dedication, growth and genuine inclusion. Today, I would also like to recognise the Westvale Men's Shed in Kings Park for its inspiring commitment to community inclusion, not just for men, but for women too. While the shed offers traditional social and woodworking sessions for men, every Tuesday they run a women's shed woodworking program, free of charge. Last week, I was fortunate enough to be invited to one of their sessions. This isn't a typical class. It's a skills exchange where women learn to use tools, develop skills, work on DIY projects and build confidence alongside experienced volunteers. Through this program, the shed creates a welcoming, non-threatening space for women to connect, create and grow. Each of the women were keen to share their current and past projects, ranging from wood-turned bowls, hardwood pens, upcycled items rescued from local hard rubbish collections, restored furniture and so much more. One of the women told me how much this community has supported her mental health since the passing of her husband. With guidance from the shed, she was able to create a wooden urn for her husband. This meant so much to her family and helped her process her grief in a different way. Westvale's model shows how community sheds can evolve, preserving their core mission of supporting men's well-being while also extending genuine opportunity and belonging to women. This inclusive, grassroots leadership strengthens our community in real, practical ways, and it's something worth celebrating and supporting. Well done, Westvale Men's Shed. Thank you.
Thank you. And I give the call to the member for Warringah.
Thank you, Madam Deputy Speaker. Australia's support system and tax system should make it easier, not harder, for our older Australians to keep working. But instead of rewarding their contribution, the work bonus now punishes them with sudden tax hits, pension losses and complex rules. At a time when we are relying on their skills and experience, the system is pushing them away. That's wrong, and it undermines the very workforce we need to strengthen. We need to tackle age discrimination in the workforce, but have more incentives in place for older Australians to continue working where they can and if they want to. I met recently with Mary and Joseph, two Warringah local residents. They're hard-working age pensioners who are living this reality. Mary teaches English at TAFE. She rents, owns no assets beyond an old car and cannot live on the pension alone. When extra classes are available, she's happy to take them, but every additional dollar above the income limit reduces her pension by 50 cents. Worse, if she crosses the income threshold of just $52,759, even by just a few $100s, she's hit with a tax bill in the thousands and goes backwards. The stress of these unpredictable penalties make her hesitate to take on extra work when it's available. This is not an isolated case. It reflects the broader systemic failures of this system. Other TAFE teachers have reported similar struggles, feeling forced to retire despite rising rents and living costs. We hear a lot in this place about the need for productivity and the fiscal impact of an ageing population. This means that we need a more flexible support and welfare system that works for our changing economy, ensuring older Australians can work without the fear of unpredictable tax bills. This should include the flexibility to manage rising rents, cost of living pressures and reduced retirement savings. We must act to keep our system fair by lifting and smoothing out the SAPTO thresholds, reviewing income test taper rates, aligning pension, work bonus and tax settings, and ensure that the ATO hardship provisions are flexible for low-income welfare recipients. A fairer system will deliver greater dignity, choice and help strengthen our economy. Now, I've written to the government and the minister about this issue, that we have to be able to smooth this out. It just makes no sense that when we have shortages, that people who are willing and able to continue contributing to take on those extra shifts, they go backwards, because as soon as they go over that threshold, the tax bill they get hit with is in the thousands. And so, and they simply can't then meet it because of the issue of cost of living and everything else being tight. So I urge the government, I hope the minister will respond and meet with me to discuss this very urgent issue.
Thank you, and I give the call to the Assistant Minister for Social Services.
Thank you, Deputy Speaker. Today I rise to honour Jenny Rayner. She's a long-standing and beloved community worker who recently retired after 18 years' service to the most vulnerable members of my electorate, Cooper. Jenny's retirement from the Jika Jika Community Centre, a local neighbourhood house, gave us all pause to reflect on her work over almost 2 decades. Jenny ran playgroups at the beginning, critical for connection between parents and the development of children. She then worked providing outreach to the residents at the Walker Street public housing estate, where she ran homework programs and advocated for the public housing tenants there. At the High Street housing estate, Jenny ran everything from cooking classes to putting in vegetable gardens and caring for the residents there. She organised hampers for Christmas and delivered meals and ran activities like the popular chalk drawing competition during COVID. All these programs and activities are about connection. They're about people-centred, community-centred care. They are programs designed to meet real need on the ground, programs that can't be easily accessed elsewhere and that foster healthy, connected living while addressing unmet need and essential support for anyone who needs it in our community. When I think of Jenny and her work, she embodies the essence of community work done right across Victoria through our neighbourhood houses. It reminds me of the many wonderful community workers now in retirement. And while these are not exclusively female domains, it happens to be women from neighbourhood houses who have provided timely and effective services to the community over many decades. Great women like Marie Goonan, Angie Davidson, Gina Whittingslow and Colleen Duggan, who all left our community stronger and more resilient through their tireless work and advocacy. I thank Jenny sincerely and all the workers in neighbourhood houses. These are amazing spaces designed to meet hyper-local needs, centred in neighbourhoods with the diverse needs of each location in mind and in heart. They are spaces that provide friendship, support learning and well-being. I don't know of any other space where anyone can drop in for a cuppa to reduce their isolation, collect a food parcel, speak to a support worker, learn a skill, volunteer, join an activity group, and the list goes on. All of these activities provide support to improve the well-being of community members. This is not a flippant statement, it is a fact. Neighbourhood houses contribute $21.94 value for every dollar of funding they receive. I'm sure there's not an MP amongst us that doesn't appreciate the value of neighbourhood houses. And to all the workers in neighbourhood houses across Victoria, thank you for putting community first. Your responsiveness is what brings care, compassion, knowledge and dedication.
Thank you, and I give the call to the member for Warren.
Thanks, Deputy Speaker. And it's great to be able to rise today and say that common sense has prevailed. And it's not very often that I am able to say in this chamber that common sense has prevailed under this Albanese Labor government. But for the first time in a long time, it has. And you know why? It's because, and the minister's here and I'm pleased that she's here, the government made the common sense decision to say we're not going ahead with reducing speed limits on regional rural roads back to 80 kilometres, back to 70 kilometres. And I've got to say the coalition has advocated strongly against this decision, and I recognise the member for Barker, who along with me has been campaigning on road funding for the last 4 or 5 years because sadly it has been cut under this Albanese Labor government. But can I say this? We at last have seen some success because the Minister for Infrastructure has said she's not going ahead with this harebrained idea to cut the speed limit back down to 70 or 80 kilometres. But now what we need to see, Deputy Speaker, we now need to see the Albanese Labor government fix the roads. They've made the decision that they now will not cut speed limits, but now they need to fix them. And I've got a few places where, and luckily the minister's here, where I can suggest that they start in my electorate. The Princes Highway, we put in $60 million to fix the piece of road between Warrnambool and between Port Fairy. They did the job, but only half did the job. So go back, do the job properly, and that will make my constituents in Port Fairy and Warrnambool very happy. There's also the Western Highway. Now, the Western Highway runs past Ballarat to Beaufort and then on to Stawell. Fix that. Fix the duplication between Beaufort and Ararat. Fix that, and that will make my constituents incredibly happy. And there are numerous more roads which we'd like to see extra funding go into. So I'm glad that the minister's here, because she's hearing directly from my constituents as to what needs to happen. People's cars are being damaged. The potholes have got worse and worse and worse. And instead of the Prime Minister being in Melbourne announcing billions and billions of dollars for the suburban rail loop, fix the existing infrastructure. Why would you spend billions on these projects when your existing infrastructure is deteriorating before your eyes? So, Minister, you've got a big job, but at least you saw common sense on not reducing speed limits.
Thank you, and I give the call to the Minister for Veterans Affairs.
Thank you, Deputy Speaker. Last week I welcomed Assistant Minister for the Prevention of Family Violence to my community to see a new approach to supporting people in WA impacted by family, domestic and sexual violence. The Perth South FDSV Local Link pilot will help general practice teams to intervene early and connect victim survivors with support. The pilot program in our community sees Anglicare in partnership with Starrick, a local domestic violence support service that I was proud to be the chairperson of before entering Parliament. Through this partnership, they are embedding social workers into general practice clinics in Perth's southeast, with plans to expand the program to accept referrals from any GP clinic in Gosnells and Armidale. One clinic leading the way is Pramana Medical Centre in Gosnells, who walked Assistant Minister Kearney and myself through their engagement with the program. Pramana is a leading general practice in our community and indeed in the country. Named a Medicare Champion Award clinic earlier this year by the Minister for Health and Ageing, Pramana was just one of 2 centres in Western Australia receiving an award for their support to vulnerable communities and an innovative model of care. I also want to offer my congratulations to Dr Raji Krishnan from Pramana Medical Centre, who this year has been recognised with multiple awards for the amazing support she provides in Gosnells, with constant effort to reach disadvantaged communities and go that extra mile. In August, Dr Raji was named the Western Australian GP of the Year by the Royal Australian College of General Practitioners in August and awarded the 2025 AMA President's Award. This month, Dr Raji was named Australia's 2025 GP of the Year by the RACGP for her tireless and empathetic service, especially to Aboriginal and Torres Strait Islander patients. Congratulations to Dr Raji. Our community is so proud of you and grateful for the work that you do. It might be time to buy a new trophy cabinet, though. And this is all important because accessing a GP when you're sick should not be a struggle. The Albanese Labor government is delivering more bulk billing for all Australians so that we can all see a GP for free. With the largest investment into Medicare ever, we've expanded the bulk billing incentive to all Australians and boosting payments to practices that bulk bill every patient. In my community of Burt, we've already seen clinics signing up to bulk bill every patient, and by 2030, 9 out of every 10 visits to a GP will be bulk billed, with triple the number of practices bulk billing every patient. You can find a fully bulk bill practice in our community by visiting the Health Direct website. After a decade of Liberal cuts and neglect, we're turning around the free fall that they left our Medicare system in. Labor created Medicare and the Albanese government is strengthening it.
Thank you, and I give the call to the member for Herbert.
Thank you, Deputy Speaker. Can I start by congratulating Nick Demeto on his resounding win in the mayoral by-election in Townsville. Nick, a former state member, not in the same political persuasion as I, decided to resign his seat in the state parliament and run for the City of Townsville mayoralty. He won resoundingly, and no, it's okay. And I'd like to let Nick know, as well as the parliament and the wider community, that we look forward to working closely together to ensure that the people of Townsville have a mayor that puts them first, not politics, that can work with all colours of political persuasions to get the job done for the people of Townsville. We've seen neglect over many, many years from former Labor mayors that haven't put the people of Townsville first. So having a new mayor is a breath of fresh air. And I believe that Nick Demeto resigning his position with the KAP, leaving the political party, demonstrates that he is willing to put people before politics. I'd also like to say congratulations to Andrew Gissinger and his team. on an amazing 20-year celebration of Q Solutions. He spent 22 years in the Australian military and he bedded down his position with his company based in Townsville. Now, when business does well, a lot of people, a lot of business leaders leave the regions to set up in the capital cities. Andrew and his team decided not to do that. Now, whether they work in Townsville, Brisbane, Western Australia, Papua New Guinea, all around the world, their base is Townsville. They employ locals, they support locals because they know the importance of getting behind the great city of Townsville. Andrew had his 20-year celebration with his business, and there was mayors, former ministers, state MPs, federal MPs, and it was clear to me that Andrew and his business has seen more political change. There's lots of political change, but he will also be there long after all of us have been in this place and have left. And I think that's a testament to him and his strong business that have put roots down in Townsville. It will be great to see the business grow and thrive, and I hope that naming the 2 extra partners for Q Solutions does him well as he slows down and goes into a bit of retirement where he can enjoy his life. But from the people of Townsville to Andrew and his team, we say thank you. Thank you for employing locals. Thank you for driving our economy. You're a good man.
Thank you, and I give the call to the Assistant Minister for Defence.
Thank you, Deputy Speaker. Last week, my office hosted my neighbour, the member for Maribyrnong, Joe Brisky, and the local state MP for Broadmeadows, Kathleen Matthews-Ward, and the Glenroy Post Office Working Group, a local working group led by John and Sonia Rutherford. We've had many meetings with that working group over the years, the last 2 years, since the closure of the Glenroy Post Office in 2023. And I wanted once again to commend the work of the entire working group, all those locals who care, as we continue to advocate together for Australia Post to reopen an LPO in Glenroy. The effects of this closure that occurred 2 years ago cannot be underestimated for the community, the elderly, people with disability, local shopkeepers, people that don't have cars. Many others have felt the negative effects of the post office closing. However, our pleas to reopen a Glenroy site have fallen on deaf ears. Despite the improper metrics, they measured the foot traffic while the Glenroy train station was being rebuilt, so that didn't give an accurate reflection, and there was a lack of community consultation. There's still resistance to reopening this vital community service. The Glenroy Post Office closure is not unique to my electorate. I know this is occurring in many electorates around Australia, and many constituents have contacted my office, and I'm sure other MPs here, in distress about their inability to access a local postal services. My hope, Deputy Speaker, is for the Glenroy community and those affected across the country that Australia Post continues to come to the table with realistic solutions toward the viability of postal services. It is a community service. It is not just for profit. This is a service that's been provided for government for hundreds of years, like the military and the police and other frontline services. This is important for community. They're consulted when these local changes are happening, and we'll keep fighting for them. Deputy Speaker, also disappointing it was to learn through the media just last month that the local community health service, CoHealth, planned to cease operations at 3 of their clinics in Melbourne's inner north. This will impact thousands in my community, many of whom I've spoken to directly in the past month. The announcement by CoHealth's board was not done in consultation with our government. We actually found out, as the public did, through the media. But once we found out, the Albanese Labor government jumped to action, repeatedly urging CoHealth's board to pause their decision. The Department of Health and Primary Health Network have been trying to work with CoHealth to help them utilise the record investments that Labor have made into Medicare. Now, we don't want any compromise of the high-quality, complex care that they provide. And in fact, Minister Butler, Mark Butler, just last week announced $1.5 million additional federal funding to assist CoHealth to keep these clinics open at least until 31st of July next year. But this issue isn't over, Deputy Speaker. I want them to understand, this board, that they provide an essential community health service. We want to work with them together to make sure that these clinics stay open.
Thank you, and I give the call to the member for Grey.
Speaker, I rise to address the government's recent announcement regarding new endometriosis and pelvic pain clinics. While this announcement is fantastic on the surface, underneath is a profound disappointment for South Australia, the Health Minister's very own state. The minister claims to be levelling the playing field, yet for regional South Australian women, the field remains uneven and the game hasn't even started. We are told these 33 clinics ensure care closer to home. This is an insult to South Australia. Of the 33 clinics overall, only 2 are in SA. Of the 11 new locations, 0 are in SA. That is right, 0. In my electorate of Grey, we are left relying on a single existing clinic in Kadina. While the staff there are dedicated and do a fantastic job, they are drastically understaffed and facing an impossible workload. Endometriosis affects 1 in 7 women, causing debilitating pain, and one Solidarity clinic cannot physically serve tens of thousands of women across our vast rural and regional expanse. The government claims they are stopping women from struggling in silence. However, by ignoring our state's desperate need for additional resources, they are effectively silencing women on the Eyre Peninsula, the Mid-North, the Upper Spencer Gulf and beyond. How can the minister speak of dignity and access when some women in regional SA face a 7-year diagnostic delay, exacerbated by geographical isolation? This $800 million package rings hollow when access remains a postcode lottery, a rigged lottery, a lottery where regional SA never wins. It is unacceptable that despite this significant spending, South Australian women remain an afterthought. We do not need more press releases. We need funded, staffed clinics. This announcement completely fails regional South Australia. Speaker, Uniting Country SA are tireless advocates for our region's most vulnerable young people, and I specifically want to thank Helen Warby from the Kadina team for illuminating a critical issue: the urgent need to keep country kids in the country. When children enter the protection system, the trauma is profound. Minimising the pain requires keeping routines familiar, ensuring students remain in their local schools, stay close to family and keep siblings together. Consistency is powerful. The statistics, however, are sobering. As of July 2025, nearly 5,000 SA children are in care. While dedicated families care for over 1,600 of them, demand in our region outstrips supply. Agencies reported an increase of 80 children needing placements this year alone. Unfortunately, SA has the highest rates of residential care, which cannot replicate the warmth of a family home. To our foster parents, thank you. Your dedication builds brighter futures.
Thank you, and I give the call to the Minister for Infrastructure.
Thank you very much, Deputy Speaker. Well, of course, little schools do matter. They're the words of Marie, a mum of 4, an active school community member at Lal Lal Primary School, one of a number of proud local schools who are celebrating their 150th anniversary this year. The Lal Lal celebration was a brilliant event with songs from the students, the retrieval of the time capsule and plenty of cake, of course. I'd met the current grade 5 and 6 students here in Parliament House in October, but it was really exciting to also meet 94-year-old Pat, a grand matriarch who attended the school in 1937, and of course 100-year-old Jim, who attended the school for a month back in 1931 while he was staying with his grandma while his mum was having his sister. Trentham Primary School also celebrated their 150th anniversary this past weekend. They celebrated with a sausage sizzle, slushies and a lot of dancing and, of course, cake. My sister-in-law, Karen, who's actually here in Canberra this week, and her sisters all attended this little school in the 1960s, and they still have very fond memories of it. I was proud to attend the Clunes Primary School 150th anniversary in July this year, and I look forward to celebrating the 150th anniversary of Warrenheip Primary School on the 7th of December. It really speaks volumes of just how much little schools do matter, and that so many people are coming together to celebrate these momentous occasions. There is, of course, nothing quite like the Ballarat Show. 2025 was the show's 170th year, but the first in its new Mount Rowan home. It's always a huge and fun-filled day for local families, from dashhound races, camel rides and miniature goats to competitive wood chops and motocross professionals doing exciting tricks. I'm not the only one who loves the show. In fact, over 20,000 people visited this year, 5,000 more than last year's show. I was very pleased to support the Ballarat Agricultural and Pastoral Society with a $1.5 million election commitment in April this year. The funds will go towards the new event and exhibition centre. It will be a versatile and modern venue able to host everything from agriculture and wine shows to workshops and community get-togethers. I want to congratulate particularly Kerry, Matt and the rest of the volunteer committee who've done a brilliant job of relocating to the new premises and continuing the show's proud legacy. I also just want to briefly speak about the huge increase the Albanese Labor government is giving to regional road funding. Two things that really shocked me when I first became the minister was the cuts that had been made to road maintenance funding under those opposite, the cutting, the freezing of indexation to road maintenance funding. And now that we have doubled Roads to Recovery, $1 billion is going each and every year to our local governments for the roads that we work on every single day.
And I give the call to the member for Casey.
Deputy Speaker, and this month I was privileged to hold my Casey Volunteer and Community Awards and my Casey Apprentice and Trainee Awards. Volunteers, community groups, apprentices and trainees had their dedication to our region recognised across the two ceremonies.
And I ask the member to pause. The division has been called for in the House. The proceedings are suspended to enable honourable members to attend the division. The proceedings will resume when the chair of the Federation Chamber is resumed at the conclusion of the division or subsequent divisions. And the member for Casey in continuation.
At the Casey Volunteer and Community Awards held on Saturday the 8th of November, 3 community groups and 70 individuals were recognised for their outstanding service. It was an honour to celebrate the heart of our community and offer well-deserved recognition. Our volunteers are the people who consistently show up and dedicate their time to make the Casey community strong and connected. They give so much without ever asking for anything in return. And I'd like to acknowledge the 3 community group recipients. She Won't Be Right Mate, Southern Cross Kids Campus Yarra Rangers and the Philanthropic Collective. I'd also like to acknowledge the many individuals across the region who were recognised, including representatives from the CFA, local sporting clubs, community houses, guides and scouts, emergency services, food relief organisations, Rotary, Lions, historical societies, men's sheds and so many other local groups. And at the Casey Apprentice and Trainee Awards held on Thursday the 20th of November, 10 local apprentices and trainees were recognised across a variety of fields. And it was encouraging to see so many local business owners nominate their apprentices and trainees. These awards highlight that university is not the only pathway to success and that trades are vital to our region's future. The event also recognised the contribution apprentices and trainees make to local businesses. And I'd like to acknowledge the award recipients. The winner, Eden Roberts, apprentice chef at Dudley's Restaurant in Olinda. And the runner-up, Jaron Stevenson, he's an electrical apprentice at Stretch Electrics in Lilydale. And the distinguished finalist, Amelia Kleehammer, a trainee chef at Three Sugars Cafe in Warburton, Lily Reynolds, a hairdressing apprentice at Blondin Co in Yarra Glen, Nathan Robinson Darvell, who's a carpentry apprentice at Multarona Constructions, and the other finalists, Ebony Eagleton, a plumbing apprentice at Specialised Plumbing Group, Aidan Keithley, a mechanical apprentice at the VACC, Hayden Neal, an electrical apprentice at Acton Electrical, Oscar Sash, an electrical apprentice in Electrical Services Kilsyth, and Tim Sullivan, an electrical apprentice at DCP Electrical in Hillsville. Across both events, it was inspiring to acknowledge the people who contribute to our community today and into the future.
Thank you, and I give the call to the Minister for Resources.
Thank you. It is with deep sadness that I record in Parliament the passing of Dr Erica Smythe AC. Erica was a great Western Australian who leaves an indelible mark on the resources sector of Australia. Erica was one of the original geologists and the first female geologist who helped uncover the vast Western Australian iron ore deposits of Newman that would eventually underpin, to this day, Australia's national economy. She was a trailblazer for women in the resources sector. Raised in Geraldton, her first job was cleaning crayfish tails on her school holidays. After completing a science degree at the University of Western Australia, she began her career in the 70s as an exploration geologist across the Pilbara. And for 7 years, she was the principal geologist for what is now the world's biggest mining company, BHP, the big Australian. Later in her career, she moved to senior roles at Woodside, where she became a vital part of the effort to grow Australia's gas exports to the region that provide the energy security the region needs. Her contribution to the resources sector was recognised by a Lifetime Achievement Award in 2010 from the Chamber of Minerals and Energy in WA, and she was the first woman to be acknowledged in this manner. And it says a lot about Erica that she had bestowed upon her Australia's highest honour, the Companion of the Order of Australia, for her contribution to the mining industry, to science and to charities. A diabetic whose life was saved by the Royal Flying Doctor Service, she donated her time and service to the RFDS as a non-executive director. She was on countless boards, but also on the board of the International Centre for Radio Astronomy Research, based at UWA, an institution I'm very proud to have a long-standing relationship with. I first met Erica when I was at the university, where we both had started as members of the UWA Senate. Erica was an established leader in the resources industry, and I was just an undergraduate. My undergraduate colleagues and I learnt so much from Erica and continued to do so throughout our careers. A mentor and a friend, she is an inspiration and leaves a great legacy. My sincere condolences to her loved ones. I would also like to mark the passing of John Donaldson, a dedicated member of the Rockingham Safety Bay branch of the Australian Labor Party. John worked tirelessly in the state and federal Labor Party campaigns since the 50s. He campaigned for Kim Beazley Sr., Kim Beazley Jr., Gary Gray, Alan Carpenter, Mark McGowan, Roger Cook and, of course, myself, and I'm very grateful for his contribution to my campaign. He poured his heart and soul into local campaigning. Labor depends on good, hard-working people just like John to fight local campaigns, to get into government, to support working people. He will be dearly missed, and it was my great honour and pleasure to be at his 100th birthday celebration recently at the Gracehaven Aged Care in Rockingham. And I want to thank the family for inviting me, and I want to pass on my condolences to his daughter, Denise, another much valued member of my branch, and my condolences to all who love John.
Thank you, and I give the call to the member for Hinkler.
Thank you, Deputy Speaker. Last week I launched a Local First campaign to celebrate all things homegrown in Hinkler. In the lead up to Christmas, the state member for Hervey Bay, David Lee, and the member for Burnett, Stephen Bennett, have joined with me to encourage my community to shop, visit, eat, buy, drink and dine local first. I thank the many businesses who have signed up for the posters to help spread the word, and I do hope it all results in a much-needed boost to our local economy. Hinkler's small and family businesses are the backbone of my community 365 days a year. Thanks to businesses such as Bundaberg's Char Char Chocolate and Avenel Brothers, Homely House at Bagara, Migaloo's Seafood and Urangan Fisheries and Rad Rolled Ice Cream in Hervey Bay, and Buck's Butchers in Childers, just to name some who have helped us kick-start this great Local First initiative. Deputy Speaker, this week 16 Days of Activism has begun in Hinkler. It's a campaign run by the Zonta Clubs of Bundaberg and Hervey Bay to eliminate violence against women. As a White Ribbon Ambassador and through my various roles in the police service and politics, I've always been a passionate advocate for this cause. Tomorrow, Day 3, is a day of orange to symbolise a brighter future free from violence. The program will conclude with a day of reflection on Wednesday, December 10. I encourage everyone to stand with our Zonta clubs to eliminate violence against women and children. Deputy Speaker, last week Peter and Joyce Drummond celebrated 70 years of marriage. The word wow was written on their anniversary cake. Married in Ballarat on November the 19th in 1955, Peter and Joyce have 2 children, Stephen and Kerry. They are also blessed to have 4 grandchildren and 5 great-grandchildren. I wish Peter and Joyce all the very best, and here's to many more anniversaries down the track. Deputy Speaker, congratulations must extend to all the winners of the recent Bundaberg and District Business Excellence Awards. There were so many great achievements acknowledged on the night, but I want to mention the Bundaberg Business of the Year was awarded to Live Life Pharmacy, Kepnock, and the Childers 2025 Business of the Year was presented to IGA Supermarket at Childers. Congratulations to all the awardees. Deputy Speaker, it's a season for celebration in Hinkler. I was proud to support the annual Fraser Coast Business and Tourism Awards and tip the hat to my region's most successful businesses and tourism enterprises. The winner of the award I had the privilege of sponsoring was the Best New Fraser Coast Business, and that went to Social Box. The Social Box team now has a full-scale operation serving up wholesome meals to people all over Hinkler, including aged care and NDIS clients and providers. And Deputy Speaker, it's a privilege to serve as the federal member for Hinkler. My family and I would like to wish those in my electorate of Hinkler a wonderful Christmas filled with love and laughter and a new year that brings peace, health and happiness.
Thank you. And I give the call to the member for Dunkley.
Thank you, Deputy Speaker. The Dunkley community is disproportionately impacted by suicide, with rates higher than the state average, particularly for men. This issue is close to my heart, which is why I recently invited Dan Repicoli, the Special Envoy for Men's Health, to the electorate. Dan's day in Dunkley began at Monterey Secondary College, where he spoke with Year 9 and 10 boys about healthy masculinities, the influence of social media and their views on the upcoming social media ban. We then visited Chisholm TAFE to meet electrical apprentices and discuss the physical and mental challenges they face, the strategies they use to manage them, and the importance of regular checkups with their GP. The opportunities reinforced how essential it is to create safe spaces for men and boys to speak openly about their experiences with mental health and wellbeing. We concluded the day with the Dunkley Men's Health and Wellbeing Forum, attended by 70 men, students and representatives from 14 men's organisations. The event was supported by the Man Cave in Movember and the Frankston Dolphins Football Club. My husband and son, Dave and Flynn, emceed the event, with Flynn reflecting on the pressures facing young men and the expectations and the reality that comparison can be detrimental to mental health and wellbeing in young men. Dan spoke about key health issues including prostate cancer, body image, the importance of regular health checkups, and asking for help when you need it. Participants also heard about current research and local initiatives identifying what is working, emerging issues, and the next steps our community can take. Activities throughout the event ensured the voices of men and boys were genuinely heard. It was heartening to see attendees commit to forming a Dunkley Men's Health Network. Last Friday, I hosted Minister O'Neill, Special Envoy Josh Burns, Minister Kilkenny and Minister Shing at the Dunkley Housing Forum. I thank the Frankston City Council and the Committee for Frankston Mornington Peninsula for their strong support of this forum. The forum brought together housing providers, funding bodies, investors and builders to explore practical pathways to address Dunkley's housing supply challenges. Together, we examined the needs, barriers and opportunities to delivering housing stock, including more social and affordable homes. As a federal member for Dunkley, I will continue bringing organisations together to collaborate and deliver outcomes that meet communities' needs now and into the future.
And I give the call to the member for Mallee.
Thank you, Deputy Speaker. I rise to express my great pride in the farmers of Mallee. They are facing an uphill battle right now. They have the Victorian government and their tentacle subgroup, TCV, Transmission Company of Victoria, who are coming onto farms. Well, actually, that's what they want to do. They want to enter farms, and instead we have farmers who are standing inside the fence saying, access denied. Access is denied to TCV and to the Victorian government for seeking to railroad my communities. These farmers are on the edge of harvest. They are literally about to start harvest. We also hear in this space that we have Chinese-made brake pads with asbestos in them. Asbestos is illegal to bring into Australia. But here we have companies all over Australia who are bringing in wind turbines with asbestos as part of the works of each turbine. creating biosecurity hazards, I would suggest, I'm not an engineer, but I would suggest that if a wind turbine goes on fire, then what is happening with that asbestos? There is food growing under these turbines. This is an absolute disgrace that the Labor government has allowed these turbines to come into Australia with no checks and balances. What is going on that this product is all over Australia now by the thousands, maybe hundreds of thousands? Renewables absolutely cost farmers, and I have farmers in my electorate, and I'll name a few of them: Andrew Wiedemann, Ross Johns, Julie Weir, Marcia McIntyre, Ben Duxon, Gerald Feeney, all of these farmers and the myriad that are coming to support them standing at the gate stopping TCV coming in. Now, TCV don't actually have court orders to be able to enter the properties. They have no right, but I tell you what, they're intimidating and they're bullying our farmers. It is outrageous at the beginning of harvest. And we hear today that the Victorian government have put out a consultation about the 5 new reses, I think there are 6 now, doubling the gigawatt powers that they require to put on farmland. I mean, seriously, a consultation over a harvest period right through to February. When farmers are at their busiest, they are tired, and now they have to do what we know already is actually a sham consultation. It is a disgrace, and both the federal Labor government and the Victorian Labor government should be held to account, and that's what we are doing on this side of the House.
Thank you, and I give the call to the member for Bennelong.
Deputy Speaker, I rise today to acknowledge an outstanding achievement by a much-loved person and markets in our community, Le Marché French Markets, and its founder, Solveig Coulon. Last night at the French Embassy in Canberra, Le Marché was awarded the French Australian Award for Art, Culture and Events, a national recognition of the contribution this market has made to Australia's cultural life. It is an honour they have well and truly earned, Deputy Speaker. For those who haven't had the pleasure of visiting, Le Marché hosts its Sydney markets at Woolwich Dock in Hunters Hill, and what they've created down there is remarkable. It's not simply your farmers' markets, but it's a celebration of French culture, creativity and community spirit. Thousands of locals flock to Hunters Hill throughout the year to experience a slice of France, its flavours, its artisans, its music and its warmth. As the chair of the Parliamentary Friends of France, I've had the privilege of seeing firsthand how cultural events just like this strengthens the relationship between our two nations. Le Marché has become one of the Sydney's most vibrant examples of that friendship in action. Solveig's leadership has been central to this success. Her determination, her years of hard work and her deep commitment to community building have created something very unique, and we are so blessed to have it in Bennelong. I congratulate Solveig and the entire Le Marché team for their wonderful recognition last night and their enduring friendship between Australia and France. Deputy Speaker, I rise today to acknowledge the life and legacy of Cole Joy, a music pioneer, a household name, and for us in Bennelong, a much-loved local from Woolwich. Cole was one of the first greats of Australian rock and roll. In the late 50s and 60s, his warm voice and cheerful stage presence helped shape a new sound and a new confidence for our country. In 1959, his hit Oh Yeah, Uh-huh became the very first #1 single by an Australian pop artist, an achievement that opened doors for many who followed. But Cole's story just wasn't about chart success. He gave young artists, including the Bee Gees, opportunities and worked behind the scenes to strengthen Australia's music industry. He was recognised with an Order of Australia for his contribution to entertainment, and his generosity continued later in life when he donated more than 1,000 pieces of memorabilia to the National Film and Sound Archive, preserving our cultural history for generations. Deputy Speaker, Cole Joy showed us that Australian artists could make their mark on the world stage. He brought joy to millions, inspired countless musicians and carried himself with warmth and humility. We remember him not only as a pioneer of Australian music, but as a valued member of the Bennelong community. May his legacy continue to inspire.
Thank you, and I give the call to the member for Dawson.
Thank you, Deputy Speaker. In Dawson, the quiet of Crystal Brook and Kelsey Creek is under siege from the threat of a wind farm that would steal a sunrise, drown out the dawn bird chorus and loom over homes and farmlands. The Mount Challenger wind farm is not a minor project. It is an industrial-scale intrusion, placed within minutes of family homes, farms, and one of our region's most treasured recreational landscapes, the Peter Faust Dam. Residents were blindsided. A handful of landholders were approached in private. Turbine locations are vague. No genuine consultation. In response, more than 120 residents have now united through the Whitsunday Wind Farm Action Group to defend their homes, their health and their livelihoods. Their concerns are not hypothetical. They are not political. They are real health concerns. Sleepless nights, persistent headaches and other known documented effects of ultrasound. Some of these turbines will be less than 2 kilometres from homes. There will be an increased heavy traffic movement on narrow rural roads, not to mention the heightened threat to our delicate ecosystem, home to eagles, brolgas and the Proserpine rock wallaby, and above all, the destruction of peace that generations have enjoyed. Deputy Speaker, these are proud rural Australians, people who have already invested in solar, batteries and sustainable practices. They support clean energy. What they do not support is a project forced upon them without respect, without honesty and without proper scrutiny. Crystal Brook and Kelsey Creek are not suitable locations for wind turbines. They are farming communities. They are residential communities. They should not be the dumping ground for poor planning and poor policy shortcuts. Yet while these communities fight to protect their homes and farmland, Australia is being asked to tolerate something extraordinary. An Energy Minister bestowed his virtues of energy and climate across the globe, while power bills have surged nearly 40%. Australians do not need a part-time Energy Minister. They need a government focused on lowering bills, stabilising the grid and protecting regional communities, not pushing reckless projects onto them. Deputy Speaker, this government's priorities are backwards. Rural communities are paying the price for policies written for people who will never live next to a wind turbine, never lie awake at night worrying about the noise, the flicker or the health impacts. These communities are entitled to transparency and proper planning. They deserve to be heard, and I will ensure that they are heard. Energy projects must go where they make sense, not being dumped in the backyards of hard-working Australians.
I thank the member and I call the Assistant Minister.
Deputy Speaker, I rise to recognise the deep contribution that Indian Australians have made to shaping Canberra. Walter Burley Griffin, the designer of our capital, spent his final years in the world's largest democracy. Today, Indian Australians helped build the city he imagined. At the last census, more than 17,000 Canberrans were born in India, making India our largest non-English speaking country of birth. Each February, the National Multicultural Festival turns civic into a celebration of the world, and India in the City has become one of its most energetic anchor events. Run by the Canberra India Council, it fills City Walk with classical dance, contemporary performance, regional associations from across the subcontinent, and, inevitably, those long food queues that signal something irresistible. Whether it's Navvash, Holymella or Diwali, Indian community events draw crowds across Belconnen and Gungahlin. I'm a regular visitor to the Gungahlin Mosque, the Baptist Sri Simwari Mandir in Taylor, and the Hindu Temple and Cultural Centre in Florey, where I especially enjoyed participating in the Chariot Walk in June. I run into Gopal Bagle, High Commissioner of India, more often than I see any other diplomat. The Indian community are regular and welcome visitors to Parliament House. This week, the member for Bean organised for members of Parliament to meet His Holiness Basilios Martynos Matthews III of the Indian Orthodox Church. Last month, Satendra Nandan and others organised an event here to mark the anniversary of Gandhi's birth. Many parliamentarians also attended the Deepavali celebration in the Great Hall, organised by the ACT chapter of the Hindu Council of Australia. Indian Australians serve in our public service, run thriving small businesses, advance research at ANU and UC, and contribute across health, education, engineering, the arts and community life. During the pandemic, volunteers from the Canberra Sikh Association and Helping ACT founded by 2022 Canberra Citizen of the Year Muhammad Ali, provided vital support to those in need. I also acknowledge Dr Mataminta Iyengar for her leadership of initiatives for women in need, and to collaborators Rafi Sagroy and Hari Iyengar from South Asian Federation ACT. On a personal note, I'm excited to be travelling with my family to India next month. As I keep telling my sons, you can't understand the world if you don't understand modern India. To the Indian Australian community of Canberra, thank you for the energy you bring to our festivals, the enterprise you bring to our economy, and the civic spirit you bring to our city. Canberra is more vibrant, more curious and more confident because you have chosen to call it home.
Thank the member, and I call the member for O'Connor.
Thank you, Deputy Speaker. And my constituents, like all Australians, treat healthcare and access to Medicare as a major priority. And during the election campaign, Prime Minister Albanese promised on over 70 occasions that Australians will be able to see their doctor with nothing more than a Medicare card. But recently published Medicare data shows bulk billing nationally stands at 77.6%, unimproved from a year ago. So the PM isn't fooling anyone in my electorate of O'Connor, where bulk billing rates have dropped to 76.1%. Under the previous coalition government, O'Connor bulk billing rates were 84.4%, which means bulk billing rates have actually dropped 8.7% under Labor in my electorate of O'Connor. In 2022, the average out-of-pocket cost for a visit to the doctor in O'Connor was $43.19. This year's Clean Bill Blue report cites average out-of-cost for someone visiting a GP in O'Connor is now at $45.41. That's an increase of 5%. Last week's West Australian newspaper published an article headlined 8.5 billion bulk bill balk. It stated that despite the much-lauded commencement of bulk billing reform, figures across Perth had failed to improve. Citing the government's official health website, Health Direct, the West found that only 2 out of 30 GP clinics fully bulk billed in each large Perth metropolitan centres of Joondalup and Midland. And in Fremantle and Mandurah, only 5 out of a collective 60 clinics advertised that they fully bulk billed. I conducted a quick search for my electorate, and the City of Albany, with a population of 40,000, has only one practice advertised as fully bulk billed. In Esperance, population of 17,000, none of the GP practice contacted had taken up fully bulk billing option, and only one clinic indicated that they were open to do so in the future. On the plus side, a constituent from Wagen, population of 1,800, responded that their town's only GP was now fully bulk billing. Unfortunately for many O'Connor towns, there is no local doctor. Increasingly, it has fallen to local government authorities to secure and sustain medical services for their residents. In 2023, the Wheatbelt Shire of Quairing made national headlines when they offered a package of $1 million to secure a GP. On top of a base salary, the Shire is providing a 4-bedroom house, plus covering all running costs at the clinic. Shire President Peter Smith told the West Australian, "If we don't have a doctor, we don't have a medical clinic, then we won't have a hospital, we won't have a chemist, and so the demise will continue." This mantra is echoed by many of the 47 regional shires across O'Connor and reiterated in the inquiry into local government sustainability currently being conducted by the House Standing Committee on Regional Development, Infrastructure and Transport. In their interim report, Chair of the committee, the member for Solomon, said, "Local governments around Australia are increasingly being..."
The member's time has expired. I thank the member and I call the member for Tangney.
Thank you, Madam Speaker. My first neighbour in Australia was Bruce Baker. My family and I migrated to Australia in 2002, and our first house was in Bull Creek in my electorates of Tangney. One day, Bruce looked over the fence and saw that I needed help with how to mow my lawn, clean the swimming pool, even with cooking of barbie, and more importantly, helped me to repair my retic. He helped me to become more Aussie. My wife, kids, and I all call him Uncle Bruce. My kids will go over to his house for treats and to be spoiled. Today, my grandchildren also call him Uncle Bruce. Mesothelioma, a word I didn't know until last year. That when Uncle Bruce told me that he had been diagnosed with this rare cancer with no cure. Mesothelioma is caused by asbestos exposure. It is terminal and aggressive. This is a painful disease. He can't breathe very well. Some nights he barely sleeps. Australia has one of the highest incidence of mesothelioma in the world. Every year, more than 4,100 deaths occur due to asbestos-related diseases in Australia. Australia bears a significant asbestos burden with 10 million tonnes. It is a pressing health concern. I want to acknowledge the Asbestos Disease Society of Australia, who have been very helpful to Uncle Bruce. Uncle Bruce is a constituent of Tangney, my first neighbour, and a very dear family friend. I have more memories and gratitude than I can ever say in one speech. Madam Speaker, I speak not only to raise awareness about mesothelioma and to advocate for eliminating this terrible disease, but also to raise awareness about the importance of having people like Uncle Bruce in Australia and in our life. A few months ago, even though Uncle Bruce was not well, Uncle Bruce stood beside me at pre-poll. His presence means so much to me. I would never forget you, Uncle Bruce, and thank you for everything you have done for me and my family. Thank you.
I thank the member. In accordance with Standing Order 193, the time for members' constituency statements has concluded, and I call the clerk.
Government business. Order of the day number 1, death of the Honourable Graham Frederick Richardson AO, resumption of debate on the motion moved by the Prime Minister.
The question is that the motion be agreed to, and I call the Deputy Prime Minister and Minister for Defence.
Thank you, Madam Deputy Speaker. If the contribution that Graham Richardson made to public life was simply measured by what he achieved as a minister in the Hawke and Keating governments, then that alone would mean his legacy was one of titanic proportions. As the Minister for Social Services, he sought to make life fairer for pensioners by increasing the earnings on their savings, by making their pharmaceutical medicines more accessible. As the Minister for Sport, he oversaw an inquiry into drugs in sport, which led to the establishment of the Australian Sports Drug Agency in 1990. And of course, as the Minister for the Environment, he put in place protections for the Kakadu National Park, and he saw the inscription of the Daintree Forest on the World Heritage List, which guaranteed its protection. And that achievement alone is one which will last long after all of us have left and are forgotten. And it is an achievement of the most enormous proportions. That Graham was so successful as a minister spoke to his intelligence, his passion, his drive, but also to his fundamental ability to get things done in this place. And yet, of course, we all know that Graham Richardson was much bigger than all of that. Politics is about the exercise of power, and that exercise is a competitive business. Thankfully, in our nation, that competition is peaceful, but it is competition nonetheless, and it happens at every level. Between parties, within parties, competition to become pre-selected, competition to sit on the front bench. And there are those who are involved in the organisation of that power, and it is far and away the most difficult task which is undertaken in political life. Graham was a person who performed that role. Now, all of us in our journeys have known those who have sought this role for all the wrong reasons, and so to have a person who comes to it with the right motives and the right interests makes their place all the more precious. Graham was empathetic. He cared about the Labor Party first and foremost. He was intelligent in the way in which he went about his business, and most of all, he was willing to do hard things and make difficult decisions, and quite often to his own personal detriment. But his performance of that role, with the likes of the former Senator Robert Ray and others, underpinned the entirety of the Hawke-Keating government, the longest-serving Labor government in our nation's history and the great peacetime government in the Australian story. And it means that, in addition to his own personal contributions as a minister, his name is rightly connected with the achievements of that government as a whole. As a person growing up and coming into young adulthood, the Hawke-Keating government was, for me, the definition of the very best of Labor. It defined for me what I hoped my life would be about. And it was a government that was filled with heroes, and amongst them, from where I sat at that age, I saw Graham Richardson as a giant. Later in life, as I came to be in this place and to walk these same corridors, it was clear that for all of us, we are on a pursuit of understanding how the Labor Party works, understanding how power works, understanding how broader politics is pursued, understanding how Australia fundamentally runs. And it occurs to me that when Graham Richardson left this place back in 1994, his understanding of all of that was as great as anyone who has ever lived. And it meant that in his post-parliamentary life, when Graham went into the media, he was incredibly successful. He knew what he was talking about. And he had an ability to cut to the heart of an issue, to understand its essence and to be able to convey that to a much broader audience and to do so with humour. It was in his role in the media where I first met Graham personally. In fact, Graham in many ways reached out to me simply to offer his wisdom and his counsel if ever I needed it. And needed it, I did. And I found myself speaking to Graham frequently. And as all of us come across problems in this place which feel at times completely intractable, Graham was a source of advice, and more often than not, he offered a way through. He was really clear about what needed to be done. And he didn't pull any punches if that involved doing difficult things, but he was deeply encouraging in the ability for us to achieve it. It was a counsel and a wisdom and a friendship which mattered to me greatly. And of course, I was not unique. There were so many others of us who have been a beneficiary of Graham's wisdom. And what it means is that in the current generation of Labor politicians in this place, Graham's mark is very much amongst us on this very day. And I'm deeply grateful for it. When I take a step back from all of that, what strikes me is the generosity of it, because Graham was already a giant. He had every reason, having left here, to walk off into the sunset, not busy himself with the difficulties of this place and to simply enjoy life. But he loved the Labor Party. He cared about us. And for those of us who were the beneficiaries of his wisdom, we very much felt that sense of care. And so the Graham Richardson I knew is a person who was characterised as a man with a giant heart. Graham demonstrated that in terms mostly in his relationship with his family. Graham had a former wife, Cheryl, and children, Matthew and Kate. But in the time I knew Graham, it was in his raising of Darcy and his marriage to Amanda where I really saw this on display. Graham loved both of them so much. Graham had real difficulties with his health. He was a long-time sufferer from cancer. And in 2016, he had a very well publicised and very appalling decision to make. His pathway forward was to have radical surgery, which involved the removal of much of his gastrointestinal tract. And it promised a future which would be one where there would be a very, very long recovery, much pain, and a very different life that would be led afterwards. It was not an obvious choice to make, actually. But I remember talking to Graham about it, and he made it clear to me that by the time he was 23, he'd lost both of his parents, and that had impacted him greatly. And as his son Darcy was growing up, he was absolutely determined not to leave Darcy without a father in his childhood. And he was determined to see Darcy achieve adulthood in his lifetime. And so he made that decision. And it was all of those things. It was painful. There was a long recovery. And life afterwards was very different. But he did return to the media. He gave his insightful commentary. He continued to be a mentor to me and to so many others. But most importantly, he was there as Darcy's father and Amanda's husband. And you know, in those years, I looked at what Graham was doing and thought it was utterly heroic. It was such an incredible thing that he was doing for his family. When Graham passed away last Saturday fortnight, he did so after Darcy had turned 18, and he did so within 48 hours of Darcy completing his last final year exam. He did indeed live to see Darcy complete his schooling and for his boy to become a man. And amidst the grief that I know that Darcy and Amanda are feeling right now, amidst the grief that we all feel right now, there is a solace in that, because it is such an incredible gift that Graham has given to Darcy and to Amanda. And for all of us who had the privilege of seeing that, it is an extraordinary inspiration. Graham Richardson very much will live on in his family. Graham will live on in what so many of us take from his counsel and in the way in which we go about our work in this place. And he is a man who is much loved, who will never be forgotten, and who will be deeply, deeply missed. Vale Graham Richardson.
I thank the member. The question is that the motion be agreed to, and I call the member for Riverina.
Thank you, Deputy Speaker. Fine words by the Deputy Prime Minister, and from another former Deputy Prime Minister. I love Richo. I really did. And he was so good to me. And you can only take people as you find them. You can only take people as you see them, as you have experiences with them. And Graham Frederick Richardson, AO, was so very, very good to me. Unusually so, because, as you just heard from the Deputy Prime Minister, the member for Corio, Richo was a Labor man, through and through. He loved the Labor Party, he did. But he loved his politics more. And he wanted Australia to be the best possible place it could be. And I think he also loved the fact that he could help and defend somebody who was being kicked, somebody who was down. And I have to say, during my time as DPM, there were times when there was a pile-on, and you knew that when there was a pile-on, most of the media, most of those in politics would also pile on, and they would kick, and they would kick hard. Richo was somebody who would come across and put his hand out. He would defend you. And when I met Richo the first time in a political sense, he was there defending me. And he came to my wife Catherine and my house, our home, and he had Amanda with him. He had Darcy with him. What an impressive young man Darcy was and is. And you could tell there was this deep bond between those three, that close-knit family. And Richo interviewed me for Sky, and he did a special on me, which was cut short by one Alan Jones. And Richo was horrified at the fact that Alan Jones, it was his show, stepped in and nipped the interview in the bud. But whilst the show was on air, you could sense this friendship that was forming between Graham and I. And it was a friendship that endured, and endured to the day that he passed. And I was very, very upset when I learned that he had died. Not just because I didn't get to experience that long lunch that we'd been promising to do for some time, but because I'd lost a very true and dear friend. And Catherine had too, and I wasn't aware of how close Catherine and Amanda were, but they were texting on the day, and Amanda I saw her in the corridor the other day, and I know she was in the Parliament this week for the Prime Minister and the Leader of the Opposition's fine eulogies and fine memories of Graham. But I have to say, Australia has lost one of its brightest beacons with the death of Graham Richardson. And he was always so very supportive and encouraging. He happily gave his wise counsel. And I'm from the National Party. I mean, just go figure this. You've got a Labor doyen, somebody who is entrenched in, call it for what it is, the union movement, the Labor movement, who reaches out across the aisle, across the political divide, and wants to help and support a National Party person at a time when that National Party person was having a pile-on against them. And I'll tell you the other person who did this as well, Simon Crean. Simon Crean and I were very, very close, and I cried the night I learnt that he had passed. And I don't cry very easily, I don't. But, when my wife Catherine, just after Easter last year, had open heart surgery, Richo reached out. He sent a beautiful bunch of flowers. And that was special. And he would be the first on the phone to ring and to offer his advice, but also to pep you up when he thought you needed it. And that's rare in politics. And I know the Deputy Prime Minister and I have a good relationship, we do, and I admire the job that he's doing, although I'd never admit it publicly. I think I just did. But, and I know the Attorney-General and I have a very close relationship. And you form these friendships across the aisle, and you do it because you want the best for our nation. You do. And I hope the member for Dixon and I can eventually in the future as well, because we're only custodians of a job for as long as the people who get to vote us in decide that we are still the person for the job. And Richo gave his all when he was the Health Minister and other portfolios as well. Yes, it was whatever it takes. Yes, he was a rogue. Let's call it for what it was. He was a bit of a rogue in his younger years, but who isn't? There's none of us are perfect. There's absolutely none of us are perfect. But he gave so much to this nation. He gave so much to politics, to the Labor movement. He wore his heart on his sleeve, and I understand. I know full well that he was one of Labor's power brokers, numbers men. He was ruthless when he needed to be. But he got on well with people across the political spectrum, and that's the important thing. He loved his country, no doubt about it. You didn't have to second-guess Richo because he was a plain talker, he was upfront, he was honest, he was straight to the point. He meant what he said, and he said what he meant each and every time. And And I know that he gave that promise to Darcy, lovely, smart, intelligent, beautiful young Darcy, that he would live until Darcy had completed his high school certificate, and he did. And he kept his word. And you know why he kept his word, Deputy Speaker? Because he was a man of his word. And he was. If he said he was going to do something, then he jolly well did it. As the Deputy Prime Minister has just said, he had so many surgical procedures. He had so much going wrong with his health, but he didn't complain. You didn't know about it. He just got on with the job. He was mortified as to his inability to do the normal, daily, everyday things that most of us just take for granted. But he was mortified as to what he was doing to Amanda and making or asking her to help him in every possible way of life. But you know, that was the Richo we know and loved. His articulate thoughts in the media, and they were articulate, always cut through. And even when Scott Morrison went on his little overseas trip, and I know I was the DPM at the time, and the whole nation was on top of Scott for doing that, Richo defended him. Richo was in there and he was saying, well, Prime Ministers need holidays too, they need a break. And the one thing that he fell upon in that argument defending the then Prime Minister was the fact that it was about family. And Richo believed in family. He believed in core values. And he also, surprisingly enough, and I'll be a little bit political here, even though he's a former Environment Minister, and you know, we can thank him for what he did to preserve and save and protect the Daintree rainforest, he also believed in, wait for this, coal. He did. And I remember he texted me one day and he said, only idiots think we can do without that black stuff. But he was sensible, he was pragmatic, unusually so for this place, and I say this place across the aisle, because he didn't always go with what you would expect him to. He didn't just always go with the grain, and because that was the party political position, he would just fall into line. And that's what I liked about him most. He was a little bit maverick, but you know, when Graham Richardson spoke, not only did the Parliament listen, but the nation did as well. And as I say, I love the bloke. He was so good. And you know, for somebody from the National Party to be saying this in a condolence motion about somebody from the Labor Party, it boils it down to the fact that we're all just human. We all just have the same desires, the same hopes, the same ambitions, the same aspirations. And the thing that Richo and I shared was a love of this nation, and I know we all do, but I will never forget the support and encouragement that he gave me. And it was when you were at your lowest ebb, and I'm sure that goes with other people too, you could always expect a call out of the blue. I say always expect, but it was out of the blue from Richo. He'd send a text, he'd give you a call, and he'd say, keep on going. He would be there to support you when, you know, the party political way would be, let's get stuck into him and let's ruin this bloke forever. No, that wasn't the Richo way. And that shows the deep love that he had for this nation, for his fellow human beings. And we have lost, yes, a combative person in the halls of Parliament, but we've lost a beautiful man who had so much more to give. And I know he gave all he had, but to Amanda and to Darcy, to the Labor Party, the Labor family, my and Catherine's deepest condolences. I will miss him greatly. I loved him dearly. Vale Graham Richardson.
I thank the member. The question is that the motion be agreed to, and I call the Attorney-General.
Thank you. I rise today to pay tribute to the extraordinary life of Graham Richardson, a stalwart of the New South Wales Labor Party and someone many from all sides of politics and the commentariat regarded as a mentor and friend. I pay my condolences to his family, particularly his wife Amanda and their son Darcy. However, I do want to spend the balance of my contribution today reading into Hansard a tribute by someone who knew Graham for more than 4 decades. The following are the reflections of Mr. David Tierney on the life of Graham Richardson. I, David Tierney, have known Graham Frederick Richardson, or Richo, for over 42 years. In 1983, when Graham first got elected to the Senate, he hired me as his researcher. I was 21 and it was my first time in a suit. Later, I served as his Chief of Staff and for decades was the behind-the-scenes number cruncher or scrutineer on those election night coverages from 1984 onward. We pioneered election night coverages well before the AEC did two-party counts on the night. And it is those coverages that first exposed the public to the young, brash senator with the bouffant hair. While we are very different people with different personalities and priorities, we immediately clicked from day one. And so it was from boss to mentor, election guru to lunch and footy buddy to a dear friend. And though we disagreed on many things, we only ever had one argument in 42 years. I apologised, even though I was right, and we moved on. Although I formally stopped working for him in 1990, at times over the years I think Graham never accepted that resignation. At times I felt I was still his Chief of Staff in perpetuity. It has been well documented that Graham was the consummate and sometimes ruthless political deal-maker. He often forged those lasting friendships over a meal. Many deals, friendships and plots were forged over meals, the most famous being the night of the long prawns, where he brokered a deal between Michael Knight and John Coates to end an AOC government financial stalemate. So when it came to fighting political battles, Graham's weapon of choice was the chopsticks. He was a master of the dark art of lazy Susan diplomacy. Nothing much got past Graham, and certainly not the lazy Susan at Sydney's Golden Century. Graham, of course, had a reputation for being a hard political operator and tough negotiator. When it came to negotiating, there was often a nuance to Graham's tactics, taught to him by his political mentor, the legendary Brother John Ducker. A nuance, but not subtle. You just openly tell the person what you would actually do and then just do it. Whenever there is discussion about Richo's ministerial career and legacy, a great legacy, the commentary often reflects the day that he, along with fellow staffer Simon Balderstone and myself, got manhandled a little in Ravenshoe, North Queensland. We were there prosecuting the case to World Heritage list the wet tropics, often shorthanded to the Daintree. As it is well reported, I won't recount the story. Suffice to say, it was a bit scary, but rather describe its instructive postscript. At the airport on the return from the rainforests, we reflected on how we had been ambushed and roughed up by outside timber workers. Graham said that it was not a fair hearing for himself nor for the people of Ravenshoe. They weren't heard either. So Graham said, "We're going back." And 2 weeks to the day that we were bashed, we were all back in Ravenshoe in the town hall. Although this time we had 4 federal police with us. We still got booed and they ended up turning their backs on us. But it reinforced the message that Graham repeatedly told his staff: you must always show up. That is, if you make decisions that directly impact people's lives and livelihoods, they have a right to hear from you and you have a duty to explain your decision to them face to face. And so in all his portfolios and party roles, he always showed up to defend his position, argue his case, and often cop a return serve. Graham's most recognised ministerial achievements focus on his work protecting Australia's most precious natural environmental assets like the Daintree, Tasmanian forests, Moor of Kakadu and the Great Barrier Reef. But he made some other major significant contributions to public policy. He drove through the largest funding package for initiatives to improve health outcomes for Indigenous peoples, programs that made a real difference to people's lives. He rewrote the model of sports funding and supercharged sports funding in Australia. He reformed the AIS, directly funding coaches for the first time and reorganising funding priorities to focus on the 10 key sports. All those measures significantly improved Australia's overall sports scene and our Olympic Games results then and in the decades that have followed. Australians have long held a fascination and love for the Antarctic. It conjures up images of adventures and wilderness. but our Antarctic expeditions had been poorly serviced. Graham developed the business model to build Australia's first and only icebreaker, supply and scientific vessel to service our Antarctic bases. And he convinced his colleagues to spend a little extra so that the icebreaker, the Aurora Australis, was built by Carrington Slipways in Newcastle. Launched by Hazel Hawke, it dutifully served Australia from Hobart for more than 30 years. Graham served at a time when there were great orators. Rann in New South Wales, Hawke and Keating, a young Kim Beazley, and a long list of very impressive and articulate federal ministers. Graham was not quite in the same league as those. While Graham spoke very well, especially to the party faithful, he could sell a message. People could and did relate to him. He would walk down the street and people would yell, "Give it to them, Richo." I'm not sure today of the exact reasons why people identified with him. Maybe a factor was that people got to know him through his election night coverages, where he would cut through the white noise, even chiding his own side sometimes. But I think of greater importance was that he used simple language to explain complex things. He cut through political spin and called a spade, because, as he often said, the mob will always work you out. While Graham had humble beginnings, it has been a long time since he could be considered a battler. Killara, Paddington and finally Dover Heights are not exactly worker enclaves. Not many worker cottages in the Heights, and certainly no revolution is ever going to start from there. However, no description of Graham is complete without reference to his lifelong commitment to helping those that struggle. As he told us, and his son Darcy as well, when you are someone, remember always look out for the little people. And he did, both in office and his private life. The best example is told by my fellow staffer, Morris Yemmer. He recalls how a group of young sole parent mums came to visit Graham with their kids when he was the Social Security Minister. As they told their story of how hard life was, with many of them not having proper meals, Graham noticed that the kids just wore sandals and had blisters on their feet from ill-fitting shoes. Graham then picked up the phone to the PM, Bob Hawke, and said, "Mate, what are you doing for lunch?" Richo didn't wait for a reply. He said, "You are now having lunch with a group of young women and their kids, as they haven't had a decent feed in a while, and you need to hear what they've got to say, and then you are going to fix it." Again, not your regular senator, and this was not an isolated case. So contrary to his image, Graham championed the causes of those that were doing it tough, a trait best summed up by the ever-astute Don Della Bosca, who said, Graham's reputation suffered from a misinterpretation of his well-known whatever-it-takes motto, but in reality he was a compassionate, public-spirited man whose sympathy was always with the underdogs. It surprises many that Graham was actually a details man. His reputation was sometimes shortened to being just a short-term political opportunist. The reality was, as most insiders and the more astute journalists, and certainly all staffers, knew, he worked hard to get across the details. He also had the inquisitive mind, always asking the right questions. For instance, on the decisions to protect Tasmania's southwest forests, he was up against some powerful forces. The major economic and resources departments of the government were monstering the much smaller Environment Department throughout the assessment process. They were pro-industry. Graham read the draft and final cabinet papers and studied the maps 4 or 5 times. So, when he went into the detailed cabinet discussions, he knew the names, numbers and values of every forest coop in southwest Tasmania. That's why over 20% of Tasmania is now World Heritage listed. Ditto the protection of the Daintree and the wet tropics, ditto Kakadu. No reflection on Graham Richardson would be complete without mentioning that he was a devoted head office loyalist. All his life, he supported the machine he helped create, sometimes to his own detriment. He believed in the role of head office, in campaigning, in managing party affairs, managing the factions and in advising governments. He was close to every General Secretary except one, since he left the role in 1983. He provided counsel and advice to all party officials, whether they wanted it or not. For party secretaries, taking a call from Richo was often like mowing the lawn, something you didn't want to do but you knew you had to. I think that even up to the day he died, he would consider himself the General Secretary in absentia. Finally, one last reflection. No matter what your opinion of Richo was, Graham actually got to live the life he wanted. He wanted to be involved in politics. He wanted to be a player in government. He wanted to make changes to society. And above all, he wanted to help people. So for someone to be able to actually live the life they wanted is a good thing. So, mate, my last duty is, for one last time, I doff my hat, my titfa, to you. Well played, son. Rest in peace. Vale Graham Frederick Richardson.
I thank the Attorney-General. The question is that the motion be agreed to, and I call the Assistant Minister.
Thank you, Deputy Speaker. I last saw Graham at the desk of the 2024 election coverage for the Queensland state election. We had a great chat together in the Sky studios. We compared notes. We sat and had a bit of a bite as we fuelled up for some 6 hours on air. We admired the fight that Stephen Miles and the Labor team had put in to their election effort, but we agreed that the likely outcome was pretty clear for all to see. We did have some highlights during that night. We shared some smiles across the desk as we watched the Greens struggle and then go backwards throughout the night. And there I was admiring his determination to be a blunt, sometimes painfully honest Labor champion, despite all of the health challenges he'd been so open about. His wife Amanda was there with him, supporting him and sharing her insights as well. And so to Amanda and to Graham's son Darcy, I share my deepest condolences. Any family that shares a family member with the public spotlight pays an additional price. And I think we all know that Amanda and Darcy have lost someone who has so much more depth and so much more love than the, quote, whatever it takes persona that many know Graham in public. As the Attorney-General just referenced, Graham didn't mind picking up the phone to give some advice to various party officials. He didn't just do it for the New South Wales branch. When I was Secretary of the West Australian branch of the Labor Party, he was happy to reach both across the continent and across the factional divide with some, at the time, very welcome advice on how to defeat the Liberals in WA, as we did. If I think back to having read at sort of the start of his engagement in politics, I can imagine the Monterey branch that Graham Richardson first joined. It's been described in many of the reports as sleepy. I think we can all imagine that sort of dull party meeting that he must have walked into and thought, as a 17-year-old, I'm here to make a difference, and everyone's there to probably whinge about head office. But just a few years later, there he was in New South Wales Labor headquarters himself, and before too long, he was running what then became known as the New South Wales Labor machine, and that was part of the passion and pragmatism that defined him. Despite being passionately from New South Wales and passionately from the right of the Labor Party, Richo was an Australian, first and foremost. The blistering opening to his first speech left you in no doubt of where he stood, with a view of that he was here to act in Australia's interest. He said, quote, "The rejection of supply by the Senate in 1975 finally debunked all of the myths of this being a states house." And he went on then to reflect on the core Labor belief in ensuring employment for all who want to work, saying, quote, "The last election was won by the Australian Labor Party on the issue of unemployment." And then, some 11 years later, gives his valedictory. And an excellent contribution after many fine arguments in that Senate. But it was with humour, flair, honesty and a very proud plug for his forthcoming book, trying to encourage senators to go and buy a copy. He said this, quote, "Senator Faulkner and I have had some disagreements. I want you to know, Senator Faulkner, that for all the appalling things you have done, I forgive you. I want you to know I harbour no grudge. Within 30 or 40 years, they will all be forgotten. But if I were you, I would be the first to buy the book in September, and I would look up the index, but I've got to tell you that you are there in large lumps, which confirms, I think, what the Prime Minister said in his obituary, which was, quote, "Richo's life was often colourful, sometimes controversial, but what lay at the heart of it was his sense of service, underpinned by his powerful blend of passion and pragmatism. He gave so much to our party, to our nation, and to the natural environment that future generations will cherish." That passion and pragmatism gave us both Prime Ministers Hawke and Prime Ministers Keating. Election wins that, in retrospect, looked easy and certain outcomes, but were nothing like that at the time, and they were very hard fought, earned and won. But it was in the environment portfolio of many have reflected that a man who loved politics and the political battle in all its dimensions really demonstrated his love for Australia itself. Quote, "The greening of Graham Richardson" was the Sydney Morning Herald headline that would define his time in the portfolio. And in that, they quote Graham as saying this: "Trees are the sexiest issue of the 80s. And I'd like to say that some of those trees might be a little bit older now in 2025, but those trees are equally as sexy today. And if we think about those forests and the natural environment which he preserved, Kakadu, Daintree, uniquely Australian locations, forever attached to his legacy. The Leader of the House, who worked for then Senator Richardson, shared an obituary for his friend, and he outlined that the "whatever it takes" headline was not just about power. As the Leader of the House said, quote, "I know the title of his book will always lead people to conclude everything was about power. I saw up close a fiercely loyal man try to drive a better health system and invest his capital before he left Parliament in obtaining what was back then the largest ever investment in Indigenous health." Graham Richardson was blunt about the realities of politics. He was equally blunt about the possibilities of what can be achieved and only achieved by Labor governments. But he also realised that the time for members and senators in this place is always limited, but the impact of the decisions can last forever. And as the Prime Minister quoted in question time yesterday, Graham had said this: "My memory won't be around for very long, but the rainforests of North Queensland will be around forever." I extend my condolences to all who knew Graham Richardson, especially to those from the New South Wales branch of the Australian Labor Party, and most importantly to Amanda and Darcy. Vale Graham Richardson.
I thank the member. The question is that the motion be agreed to, and I call the member for Spence.
Thank you, Speaker. Today we pause to remember a towering figure in the Australian Labor Party, a strategist, a fighter, a loyal servant of the movement, Graham Richo Richardson. Richo was many things over his long public life: a senator, a minister, a commentator, but more than anything, he was Labor to his bones. He understood the party not as an institution but as a living thing, carried forward by people, by values, by the promise of a better life for working Australians, and he dedicated every waking hour of his career to that mission. Born in 1949, raised in a family steeped in Labor tradition, Richo was shaped early by the stories of struggle and solidarity that define our movement. He joined the party as a teenager, not for prestige, but because he believed in something bigger than himself. By his 20s, he was already deep in the engine room of the New South Wales branch, learning, negotiating, persuading, doing whatever he had to keep Labor competitive, united and capable of governing. And then came his extraordinary career in the Senate, where he quickly became one of the most influential political thinkers of his generation. As Minister for Social Security, then Minister for Environment, he carried the same unwavering purpose: improving people's lives. The preservation of our natural heritage, Kakadu and the Daintree, bears his fingerprints to this day. He understood something profound, that working people deserve not only economic security, but a country worth passing on to their children. And in the great tradition of Labor reformers, he fought hard, sometimes fiercely, to make that vision real. Richo was known for many things: his sharp political instincts, his unmatched ability to read a room, his blunt humour, and yes, his famous willingness to do whatever it takes for the party he loved. But beneath all of that was a deep loyalty to colleagues, to friends, to the Labor movement and to the ordinary Australians he believed Labor existed to serve. He never drifted from those roots. Even after leaving Parliament, his voice remained unmistakably Labor, on television, in commentary, at party events and in quiet conversations with leaders seeking his counsel. People listened to him, not because he demanded it, but because he understood politics the way few ever will, and because his advice was always grounded in purpose, not ego. Speaker, Richo was not a saint, nor would he want to be remembered as one. He was a human, imperfect, fiery, passionate and utterly committed to his cause. But that is what makes a political life real. He believed in government as a force for good. He believed in the power of solidarity. He believed in the idea that no Australian should be left behind. And he fought for those beliefs with a seriousness and intensity that shaped a generation of Labor thinking. In the electorate of Spence, in the northern suburbs of Adelaide, where working class traditions run deep, there would be many who remember Richo not as a distant political figure, but as a symbol of Labor's determination to keep fighting for ordinary families. He spoke in a language people understood. He didn't hide behind jargon or niceties. He cut through. And whether you agreed with him or not, you always knew where he stood. That clarity, that conviction is rare. Richo's passing marks the end of an era for Labor, an era defined by bold reform, tough decisions and unwavering belief in the transformative power of government. But his legacy lives on. In the environmental protections he helped deliver, in the electoral victories he helped secure, in the culture of strategy, loyalty and purpose he instilled in the party, and in the countless Labor MPs, staffers and members who learned from him, formally or informally, what it means to serve. Richo faced significant health battles over recent years, yet even in illness he remained engaged, insightful and committed. His courage in those final years was immense. He continued to write, to analyse, to mentor, to speak his mind. He continued to give back to the movement that had given him purpose. Speaker, condolence motions remind us that politics is not just policy or contest, it is people. People who dedicate their talents, their energy and at times their health to the service of others. Graham Richardson was one of those people. He lived a big life. He leaves a big legacy. To his family, to his friends, to his colleagues in the Labor Party and to all who mourn him today, I offer my deepest sympathies. May they find comfort in knowing that his work changed this country for the better. And may they know that his contribution will be remembered, not only in history books, but in the lives of Australians who benefit from his determination and his belief in a fairer nation. Vale Richo, may you rest in peace. Thank you.
I thank the member. The member for Dixon seeks the call.
Thank you, Deputy Speaker. I move that the debate be adjourned and the resumption of debate be made an order of the day for a later hour.
The question is that the debate be adjourned and the resumption of the debate be made an order of the day for a later hour. All those of that opinion say aye.
Aye.
Those no. I think the ayes have it. The debate is adjourned and the debate is made an order of the day the next day of sitting, and I call the clerk.
Government business, statements, further statements on Mental Health Month.
Are there any statements? And I call the member for Werriwa.
Thank you, Deputy Speaker. Recently, I joined the Assistant Minister for Mental Health and the member for Macarthur at the opening of the Medicare Mental Health Centre in Campbelltown. The service is a beautiful, calm, welcoming place close to Campbelltown Railway Station, the bus interchange, and there's parking in proximity. The service is open 7 days a week and, like all Medicare mental health centres, has a range of support professionals, from pre-support workers, psychologists, psychiatrists and wraparound supports when you walk in. Medicare mental health centres are free. All you need is your Medicare card and they're available for you to walk in and find support straight away. The Campbelltown Centre is also special because it's the 50th Medicare Mental Health Centre opened in Australia and the 44th since the Albanese government was elected in 2022. For anyone needing support, there is also a Medicare mental health system located in Liverpool in Macquarie Street. All the details are on the website if you need them. I'm looking forward to joining the Assistant Minister to open our own mental health support centre in Werriwa in 2026. No one has worked harder than the members for Hindmarsh and Dobell to provide support for Australians seeking help with their mental health. The Albanese government is investing a historic $1.1 billion over a range of incentives to deliver new and expanded mental health services across the whole of your lifespan, and working with state and territory governments to provide affordable and often free support as soon as possible. In 2025, $41.1 billion mental health as part of the $1.1 billion mental health election commitment. We're committed to boosting the number of Medicare mental health centres by 30, taking the total to 91. In my part of the world, my opponents did not even match this commitment to deliver any more mental health community-based services. As part of the Albanese government's plan to strengthen Medicare, with this historic $1.1 billion commitment, people will be able to access mental health support whatever age they have. This includes the 91 mental health centres and the multidisciplinary teams, 20 perinatal mental health centres delivering support for new and expectant parents, 17 Medicare mental health kids hubs providing children and families with behavioural, social, emotional and wellbeing support, and 203 Headspace services supporting the mental health and wellbeing of young people 12 to 25 years old. And so many of these services are already up and running. Early in 2026, the Albanese government will be rolling out the new National Early Intervention Service. The service will deliver free mental health phone and online support from trained professionals, and it is expected that will support over 150,000 people each year. We know that the sooner that someone finds support that is right for them, the sooner they start feeling better, not only for them, but their families, work colleagues, and of course the community as a whole. Providing more free public mental health services for Australians with different levels of need will help relieve the pressures on subsidised services provided by private psychologists. We're also building the mental health workforce. This includes 4,000 psychology scholarships, internships and training places. This is complemented by our work to professionalise the peer workforce because we value lived experience. Next year, we're establishing a new peer workforce association and undertaking a census of the peer workforce. As we expand the range of free services, the Medicare mental health phone line, 1800 595 212 if you want to ring them, and the website medicarementalhealth.gov.au will help Australians find the service that is right for them. In Mental Health Month in 2024, the Assistant Minister and I opened the new Headspace at Edmondson Park in the electorate of Werriwa. The centre is located across the road from Edmondson Park Railway and Bus Terminal in the shopping centre, and it's been kicking goals since then. The Youth Reference Group is made up of more than 14 amazing young people. They are working hard to ensure that the needs of all young people in the area are addressed by the centre. Recently, they held a trivia night to raise funds for the work of Headspace. Unfortunately, I couldn't attend the event, but I'm told the night was a fantastic success with many in attendance. I'd like to thank the Youth Reference Group again for their insight and hard work, but also all the staff at the Edmondson Park Headspace. You're providing so much needed support to our community. The work they're doing is not just in the centre, but they also do significant outreach to several high schools in our community. I do note, however, the Shadow Minister in his reply speech in the House claimed that the government was not delivering on early intervention services. As the Minister said in her speech, we're establishing the new National Early Intervention Service, and that will be up and running early in January next year, providing phone and online mental support. The Shadow Minister also stated that our government was simply rebadging Liberal government projects. That couldn't be further from the truth. Under the Liberals, less than 10 pop-up head-to-health centres were established. We are now working towards 91 Medicare mental health systems, providing all services from peer support to psychologists and psychiatrists as a one-stop shop, free if you need that help. We've also established the virtual network to ensure every centre has access to psychologists and psychiatrists when they need it. I'm proud to be part of a government that is doing so much to support the health of Australians, with historic levels of funding for Medicare, improving access and costs for GP visits, especially more opportunities for bulk bill services, cheaper medicines from 1st of January next year, and more than $1 billion investment in mental health support. The mental health support ranges from telephone to walk-in Medicare mental health centres and Headspace. And the government is training more support workers, psychologists and peer support workers to ensure that all Australians into the future have an option to improve their lives, support their families and do wonders for our community. Thank you.
I call the member for Leichhardt.
Thank you, Speaker. I rise today to speak on the statement made by the Assistant Minister for Mental Health and Suicide Prevention, all about Mental Health Month. Unlike the days where people had been derided for when something was wrong with them, I'm proud that we are here today in this place speaking about mental health. Not long ago, in the chamber, I read a speech from a young leader in our community in Leichhardt, Claudia, about the desperate situation facing many young people in regional areas. The situation is even more desperate in our remote and rural communities, where regular mental health services are essentially non-existent. The Mental Health Month theme being this year, taking steps on your wellbeing journey. It is a journey many of us know. And I'm sure we all know someone who has suffered through dark times. Hopefully we know someone who has pulled through. Sadly, though, I think someone who might not be able to make it, some don't make it out of the darkness. And I am not immune. My life, from an outside perspective, was fairly blessed. I was playing professional sport, had a family, things were going well. Basketball was taken away from me. Age, talent, whatever it might have been, I was no longer required. Basketball had provided me with an identity, a structure, an understanding of my place in the world, a bubble. From 16 to 30, all I had to think about was that. People looked after my medical needs, they looked after my rent, my houses, people booked holidays for me. I had no life skills. I could not operate in a real world. When that safety net was removed from me, I crashed. I didn't know where to turn to help. The hyper-masculine version of professional sport tells you to harden up, tells you to square your shoulders and take the hit, tells you to keep moving forwards. And no matter how hard I would try to live by that ethos, I drowned and I got further and further down. I required intervention from people that loved me, from my friends, from my former teammates, from my family. They had to find ways to bring me back. It was not a journey that I could take alone. I wasn't strong enough. And it wasn't a question of strength, it was a question of fatigue. People think that mental health and depression is sad all the time. It's not. It's numbness, it's blankness, it's fear, it's panic, it's heavy, and it's exhausting. It is not something that people should try to face alone. And I'm glad, thrilled even, that we are able to take these steps as a parliament, as leaders, to say to our communities, it is okay. Things aren't always going to be linear. Things aren't always going to go in a straight line. Things aren't always going to be great. But there are people out there, there are services out there that can help you. People who love you, who want to see you be your best again. And with a bit of hard work, you can be. You might not get back to where you were. I am not the same person that I was as a basketballer. I am better, more empathetic. I understand myself more. It was a journey I don't wish on somebody else, but it's a journey that I needed to take. And I wouldn't be standing here without the love and the support and the help of external forces. And that's the thing that buries people, is they think they have to take it on alone. That's why I'm proud to be a part of this government that is rolling out more help for mental health, because people don't have to do this alone, and it can get isolating and you can feel trapped. Part of this is obviously the $1.1 billion mental health package, the single biggest investment in mental health services, delivering more support and care in communities backed by Medicare. Speaking to GPs, we know that most presentations these days, somewhere around 70% in my area, are relating to mental health and mental health issues. My region was rocked. COVID was very, very difficult for a service-based and tourism-based economy. The subsequent natural disasters have been difficult as well. Entire communities, Wujal Wujal was displaced, sending elders to different parts of the region, taking away that connection to community, making children go to school in places they weren't familiar. Mossman was cut off for weeks. People got stir crazy. It was difficult. My region has suffered. And that's why we're doing things like opening the mental health urgent care clinic. We're doing the things that matter on the ground to provide the services that people need so that they know when things are rough, they can reach out. Sometimes it's a whole community. The free walk-in care with extended hours with no referral or appointment is a game changer. Sometimes it can be hard to get a GP, sometimes it can be hard to take that step, to make that phone call, to have that appointment. But if you can walk in and go, I need help, and to know that there's someone there that is trained, capable, and empathetic to help you, will save lives. Absolutely it will. A multidisciplinary team, whether it's psychology you need, a psychiatric intervention, some social work, they will be there for you in a Medicare mental health clinic. But it's not just the mental health clinics. For new and expected parents, we're partnering with the Gidget Foundation to open 20 perinatal mental health centres. Changes in life bring struggles. Children, as I've discovered twice, change things fairly dramatically. If you are unprepared for this, you can start to struggle, you can start to drown. Birth, pregnancy, menopause, perimenopause can play games hormonally with women, making sometimes mental health become more and more critical. This is why places like the Gidget Foundation exist. They offer vital care, and it's not just women. 1 in 10 men also experience mental health issues upon the birth of a child. I experienced less sleep. I was one of the lucky ones. For children aged 0 to 12 and their families, we're opening 17 Medicare mental health kids hubs in partnerships with state and territory governments. We are finding that mental health issues are impacting children younger and younger, which is why the social media ban for under 16s is so important. Let our kids be kids. Let them frolic outside the way people my age did when they are younger. Let them have a break. If school is hard, with a device, school can follow you home. Without a device, you would be safe, free. We are giving this back to the children of Australia. For young Australians aged 12 to 25, we're strengthening the Headspace centres, including in my own region. When Headspace was first introduced 20 years ago, 1 in 5 young people experienced mental health distress in any 12-month period. That has now doubled to 2 in 5. We can't pretend that the advent of social media, that the COVID didn't change the way our young people see the world, which is why we're opening 58 new expanded Headspace services across the country. That will be 203 services. Understanding the unique challenges and pressures of young people. For those of us that remember that 18 to 25-year range, there is a lot of potential and a lot of hope, but there's also a lot of pressure. Pressure comes from family, pressure comes from external sources, university, from work. You're an adult, but you're not quite there. You're expected certain things, but you're not quite understanding it. It's hard, and you can get lost. But Headspace is designed specifically to cater for the young, for their needs. Because mental health is not a one-size-fits-all approach. Different stages of your life will require different types of help. Sometimes it will be peer support, sometimes it might be a clinical intervention. These packages make sure that the full gamut is taken care of, so that a broad brush is not used and we watch people slip through the cracks. Because it is people. It's wives, daughters, husbands, fathers, cousins, brothers. Every mental health illness brings a cost to those around them. And by providing this support, we strengthen families, we strengthen people, and we strengthen our country. I am very, very proud to be a part of this. My own struggles notwithstanding, this makes Australia better. Thank you.
Macquarie.
Thank you, Deputy Speaker, and I want to acknowledge the contribution of the member for Leichhardt. And this is a place where really personal stories get shared, and that's what we all bring to our roles, and it's an important thing for others to hear. When I think about mental health, I cannot foresee a time when I will ever say, job done, we've done all we need to do. I just cannot see that we will get to a point where there isn't more to do, because it feels like there'll always be more to do. But Mental Health Month does provide an opportunity to reflect on progress. And I'm very proud to be part of the Albanese Labor government, which is delivering more mental health services in the heart of communities right across the country. And I'm really proud to have been one of the advocates who has helped ensure that this is a key focus for this government. When I look back at the start of my time in Parliament, access to free mental health services was really only available in acute situations, essentially when you were hospitalised. And the biggest change I've seen in that decade is the access to free early intervention and ongoing management care for complex mental health issues through places like Headspace and Medicare mental health centres. It truly is transformational. When I came to this place in 2016, there simply was no free mental health service for young people to front up to before something happened, before they reached a crisis. After years of advocating, we were able to secure, first of all, the Katoomba Headspace, and then in more recent years, the Richmond Headspace. And of course, the Penrith Headspace was one that we set up last time we were in government. And these do and have and continue to provide access to young people. And that's why I support the expansion of these services. We're expanding to 203 Headspace services to support the mental health and wellbeing of young people, essentially aged between 12 and 25. And you might say, well, that's great for young people, but what about adults? And my experience is that for some older people who are able to go to Headspace, they are opting for an alternate service, and that is the Medicare Mental Health Centre, which is a place that anyone of any age can walk into and ask for help. And I think that help. I think that's the key thing. It's the walk-in at any time to ask for help. And they're not just open Monday to Friday, 9 to 5. The Medicare Mental Health Centre in Penrith is open 7 days a week, and the one in Richmond is 6 days a week, including evenings, Thursday evenings and Saturday evenings. Because as the mother of someone who's experienced complex mental health issues throughout their life, I can assure you it never happens between 9 and 5. And that's been taken into account in so many of the services that have already rolled out and that are in the process of being rolled out. The Medicare mental health centres, and I recently visited the Penrith one with the Assistant Minister McBride, they are staffed by multidisciplinary teams with mental health clinicians and, importantly, peer workers. These peer workers are a really vital part of the process, and I see them at my Richmond, the Hawkesbury Centre, as well as the Penrith one, and they're located in every Medicare mental health centre. And what it means is that they meet you on your level. They've been there, they've walked in your shoes. And care in these centres is tailored to the needs of each person, with wraparound support for people with a more ongoing need. No appointment, no referral, no mental health treatment plan is needed. You literally walk in. 91 Medicare mental health centres are on their way offering free walk-in care from this multidisciplinary team. The expansion has been part of our plan to strengthen Medicare, and we made an historic $1.1 billion commitment at the election to deliver these new and expanded mental health services. And it's across the whole lifespan of Australians. So it includes 20 perinatal mental health centres to deliver support for new and expectant parents. And I had a fantastic update just this week on the plans for the Penrith service. And I'm really looking forward to more details of the location of that one coming out, because we know how important those first few years are. They can be tough on mums and dads, but they can be formative for children. Well, they are formative for children. And so these perinatal mental health centres will unlock a whole other way of accessing support at a time when things are already quite complex. Even if everything's going well, it's never the easiest time in parents' life, especially a mum's life. We're also creating 17 mental health kids hubs to provide children and families with behavioural, social, emotional and wellbeing support. So we're really looking at these free services being expanded across the entire range of need. And from early next year, we're rolling out the new National Early Intervention Service. And this will deliver free mental health phone and online support from trained professionals. We just were shared the details again this week of the organisations selected to deliver this free digital mental health service. It's going to be called Medicare Mental Health Check-In, and St Vincent's Health Australia has been tasked to deliver this service from the 1st of January next year. So the Medicare Mental Health Check-In is part of our commitment to make sure that no matter where you are, whether you're in peri-urban areas like mine, whether you're at the top of my Blue Mountains or beyond, whether you're way up in World Heritage area and not easily able to access centres based in places like Richmond or Penrith or Katoomba, that you can access support. And this is a free digital mental health self-help tool. It'll give you access to self-help tools and low-intensity cognitive behavioural therapy. And CBT is part of so many support treatments that people receive. It'll be delivered by trained professionals via phone or video. And so I'm very excited to see the impact that the Medicare Mental Health Check-In has. It's for anyone over 16, and you don't need a referral from your GP to access it. We'll also be encouraging people to seek help early. And having had personal experience of the quality of care of the St Vincent's mental health team in our family, I look forward to seeing the product that they roll out and how they work with the various stakeholders to get this right. Deputy Speaker, as we see the range of free services expand, and everyone should know the Medicare mental health phone line, 1800 595 212. Everyone should know that there's a medicarementalhealth.gov.au website to help you find the service that you need. Now, you can't do any of this unless you build a workforce, and as I reflect back, we have been able to build that workforce with more than 4,000 psychology scholarships, internships and training places, plus our focus on peer support workers. And that is, next year will be the new Peer Workforce Association with a census of peer workers. I think, Deputy Speaker, I know I'm not alone in advocating for better mental health services, and I really want to pay my tribute to Assistant Minister McBride, who has used her professional experience in the sector to drive so much of the reform that we're seeing, along with the Minister for Health. Our Special Envoy for Men's Health, the member for Hunter, has met people in my electorate, including Panthers, the Nepean Blue Mountains Hawkesbury Prostate Group, Walk It Off, Men's Shed and Lions to hear their stories and concerns around mental health. And the Panthers Wellbeing Officer, Kevin Kingston, shared the work being done to focus on wellbeing on and off the field for players, coaches and support teams. And this is work that happens in our community. I know groups like Reach Out are doing incredible work, and I met recently with a delegation of young people, including Sina from Bligh Park, to talk with me about their research on the need for trusted mental health information online so young people know what to trust. And as the co-chair of the Parliamentary Friends of Eating Disorders Awareness, we will continue to do work so that people suffering from an eating disorder can be able to control what they see online. So much more to do, and very proud to keep doing it.
I call the member for Bean.
Deputy Speaker, Mental Health Month has been an opportunity for us to reflect on an important issue that deeply affects our community. I thank the member for Macquarie for her fine words. I think the Assistant Minister for Mental Health and Suicide Prevention put it best when she made her statement on significant matters in the House, when she said, mental health is health. It's central to how we live, work and connect. I want to thank the Assistant Minister, the member for Dobell, for her extraordinary work in such an important area of public health and policy. Mental health considerations are front and centre across the work of this government, and that is large part thanks to her work and advocacy supported by Caucus. And Deputy Speaker, Mental Health Month presented us with a moment to take stock not only of the challenge we face with regards to mental health, but also to review what our government is doing about it, while being cognisant that this is an issue which is with us year-round. We all have a sense, Deputy Speaker, of the scale of the challenge that faces Australia. No one in this place or outside of it has avoided being impacted by poor mental health. Millions of Australians experience poor mental health every year. If someone themselves has not needed mental health care, then they have undoubtedly known and cared about someone who has. Some will experience poor mental health once or twice. For many, it's an ongoing health challenge which requires treatment and care. For too long, Deputy Speaker, too many suffered without appropriate, timely or quality health care. The sheer scale, diversity and complexity of the mental health challenge is staggering. As the Assistant Minister outlined and reminded us in her statement to the House, mental health is the #1 reason that Australians visit their general practitioner today. For 8 years in a row, mental health issues have topped the list of concerns that are raised with GPs. More than 70% of general practitioners have reported this trend. The Deputy Speaker, the Labor government has been listening to the community and health practitioners, and we are acting to provide the necessary support and resources for this important challenge. The theme of Mental Health Month this year was taking steps on your wellbeing journey. Deputy Speaker, that is a very good summation of what our government is seeking to facilitate and make easier for all Australians. We're doing this to the tune of $1.1 billion. This is the largest mental health package, the single biggest investment in mental health services backed by Medicare. And what this looks like in practice is impressive. We are establishing 91 new medical mental health centres. We are establishing 20 new perinatal mental health centres. We are establishing 17 Medicare mental health kids hubs, which will provide children and families with behavioural, social, emotional and wellbeing support. And we will establish and support 203 Headspace services, which will support the mental health and wellbeing of our young people. Deputy Speaker, I was happy to host the Assistant Minister in my electorate of Bean not long ago to see what this $1.1 billion package means on the ground in my community. In July, I opened a new Medicare mental health centre in Tuggeranong with the Assistant Minister. It is operated by Think Mental Health and funded through $3.5 million to the ACT Primary Health Network. The centre on Eileen Good Street, just down the street from my electorate office, is a welcoming, calm environment, staffed by a multidisciplinary care team which includes mental health clinicians and peer workers. Their care that they offer is tailored to each person who visits the centre. And crucially, Deputy Speaker, you don't need an appointment. Referral on mental health or referral or mental health treatment plan to access support at the centre. All you need is a little piece of green plastic, your Medicare card. I couldn't be happier that my constituents now have a local, accessible walk-in centre providing mental health support. I've had many conversations with staff over the first few months of its operation, and already they've become a well-understood, respected and regarded part of our health ecosystem. And having a free, ready, walk-in access to mental health support is a real win for the people right across Bean, and it's already making a real and tangible difference on the ground. But, Deputy Speaker, this wonderful Medicare mental health clinic is not the only new piece of mental health infrastructure that will help so many in Bean. Next year, we will deliver a new perinatal mental health centre in Tuggeranong, the same location as the Medicare mental health clinic, in the heart of my electorate. We know how stressful pregnancy and new parenthood can be, and that it's a period when poor mental health can become more common. New and expectant parents in Bean will be able to get free and personalised mental health support through this new centre. This support will run for families from the perinatal period to the first birthday of the baby. We know that the demand is there for these services, and through this centre, families will be able to get services without cost. The centre will be operated by the Gidget Foundation, and I can't wait for it to open next year. And I would like to applaud the Gidget Foundation for the extraordinary work that they've done right across the country in promoting the need for this perinatal support. And Deputy Speaker, beyond this, and coming up very, very quickly in early December, our social media ban for young people under the age of 16 will make a real difference for their mental health. We have been listening to parents, experts and schools. In particular, I've been engaging with local schools on this topic, including today. There were 2 schools from my electorate in today grilling the Prime Minister and the Minister for Communications for Behind the News, that iconic ABC program. And their questions were pretty tough, but both the Minister and the Prime Minister were able to provide pretty good responses about why the ban will make such a difference to mental wellbeing for young people right across Australia. And the feedback from young people across our schools is clear. Social media is a vector for poor mental health that many of them have experienced, and that our action on this front will make a real difference to their lives. Deputy Speaker, the government is taking steps to improve and support the mental health of all Australians. But we know that there's always more to do, but we're very much moving in the right direction, and we are working with our communities of health practice right around the country to do what we can to support Australian families and communities. Thank you.
I call the member for Hughes.
Thank you, Deputy Speaker. It's always an immense privilege to meet the people working on the front line of mental health care in our community. People who show up each day with empathy, professionalism and purpose. Right now, 2 in 5 young Australians are experiencing mental health distress, double the rate from 20 years ago. During Mental Health Month, I joined the Assistant Minister for Mental Health and Suicide Prevention, Emma McBride, to visit the Liverpool Medicare Mental Health Centre, right in the heart of south-west Sydney. It's one of 50 Medicare mental health centres now open across the country, part of a new model of care that brings mental health support into the middle of communities.
A division has been called for in the House. The proceedings are suspended to enable honourable members to attend the division. The proceedings will resume when the Chair of the Federation Chamber is resumed at the conclusion of the division or subsequent divisions. I call the member for Hughes in continuation.
Thank you, Deputy Speaker. It's one of 50 Medicare mental health centres now open across the country, part of a new model of care that brings mental health support into the middle of communities where people live, work and seek help. Since opening in 2023, the Liverpool Centre has delivered more than 23,000 occasions of service. That means thousands of people across our region, people who might otherwise have gone without care, have been able to walk through the doors and receive the support they need. These centres represent a shift in how we think about mental health care. They remove the barriers that too often stop people from seeking help. The need for a referral, a diagnosis or even an appointment. You can simply walk in and be seen by a multidisciplinary team of mental health clinicians, nurses, counsellors and peer workers. These are people who understand the complex medical system, but more importantly, they understand people. When you step inside the Liverpool Centre, there's a sense of calm and care that's not common in healthcare. It doesn't feel clinical or intimidating, it feels human. There's a sense that help is here, that someone is ready to listen. I met staff who spoke about supporting people at some of their lowest moments, people in distress, people who have been waiting too long for support, people who just needed someone to take them seriously. For many, centres like this are the difference between isolation and recovery, between being seen and being overlooked. And this is what the Albanese Labor government means when it says it's putting mental health at the heart of Medicare. It's about building a system that treats mental health just as importantly as physical health, not just as an afterthought or a luxury or a separate lane of care. In Liverpool alone, the Albanese government has invested $18.4 million to fund the centre's operations, and it's already transforming lives. In October, this government also opened the new Medicare Mental Health Centre in Campbelltown, providing even more south-western Sydney residents with access to free, walk-in mental health support and care. When we invest in services that meet people where they are, we strengthen the fabric of our community. Mental health isn't an abstract policy, it's deeply personal. It's in every family, every workplace, every street in our suburbs. And I've heard firsthand across Hughes, parents worrying about their children, young people struggling with study or work pressures, adults trying to balance family, finances and well-being, seniors feeling isolated. Mental health and resilience is part of all our stories, and that's why this new network of Medicare mental health centres is this government walking the walk, not just talking the talk on mental health. I also had the opportunity to visit Headspace Liverpool and Headspace Miranda on National Mental Health Day. Both of these services do remarkable work supporting young people across south-west Sydney and the Sutherland Shire. At Headspace Liverpool, I met a team that's passionate about creating a space where young people feel safe to open up. The service is welcoming, warm and led by people who know that early intervention can make all the difference. It's amazing to see how well networked this program is with local high schools and how these programs are growing from strength to strength. That's why the Albanese government is expanding Headspace centres to 203 locations nationwide. Speaking to the staff at Headspace Liverpool, you can see how seriously they take that mission. Their outreach into schools, TAFEs and community organisations means help isn't hidden behind a waiting list or a long drive. It's part of daily life. For many young people, the hardest step is the first one, which is seeking the help they need. And once they do, the transformation can be incredible. As part of the Albanese Labor government's $1.1 billion mental health election commitment, over $200 million will be invested in 58 new, upgraded and expanded Headspace services. Headspace Miranda will receive $2.5 million through the Headspace Demand Management and Enhancement Program to hire additional clinicians and relocate the service to expand capacity and improve care. I visited Headspace Miranda to meet with staff and members of their youth reference group and discuss all the great work they're doing. This centre supports young people across the Shire, an area that, despite its beauty and strong sense of community, isn't immune to the pressures young people face. At Miranda, the team shared stories about how they've supported young people dealing with everything from exam stress to family breakdowns, loneliness and depression. They spoke about how they're seeing an increase in family violence and child protection concerns, but that also more young people are reaching out for help earlier, which is highly encouraging. In the Shire, I often hear from families who are trying to support their kids through tough times. Sometimes they're not sure what to say or how to help. Services like Headspace Miranda give those families a starting point. They give young people a safe space where they can find understanding and care without stigma or judgment. And it's not just for crisis care. Headspace helps young people develop the tools and confidence to manage their well-being. That building of resilience is critical, and it will last them a lifetime. When we talk about mental health, we often talk about numbers, how many centres, how many appointments, how much funding. Those numbers matter, but what matters more are the people behind them. The young people who walked into Headspace Liverpool and found hope. The peer worker at Miranda who turned their recovery into a career of helping others. The clinicians at the Liverpool Medicare Mental Health Centre who open the doors each day to anyone in need, no referral required. These are the people building a better mental health system in real time. And as a government, we're supporting that with the largest investment in mental health in Australia's history. $1.1 billion to expand access to community-based care backed by Medicare. That means more services, more staff and more options for people at every stage of life. It also means acknowledging that one size doesn't fit all. For new parents, we're opening 20 perinatal mental health centres in partnership with the Gidget Foundation. For children, 17 new Medicare mental health kids hubs are being rolled out across the country. For young people, the Headspace network continues to grow and evolve. And all of this work shares a single vision, that mental health care should be accessible, compassionate and local. I want to thank each clinician, counsellor, peer worker, receptionist and volunteer that works so hard across these services. Your work is vital. You're saving lives every day, often quietly without recognition, but always with impact. I also want to thank the families, carers and loved ones who support those experiencing mental ill health. The strength, patience and love you show are the backbone of our community's mental health response. Mental Health Month's theme this year is taking steps on your wellbeing journey. From my conversations in Liverpool and Miranda, one message stands out. The first step is often the hardest, but it's also the most powerful. This always bears repeating because of the devastating impacts mental health can have in our community. If you're struggling, reach out. If you're not sure where to start, walk into one of our Medicare mental health centres or your local Headspace. You don't need a referral, you don't need to wait, and you don't have to do it alone. Together we're building a system that meets people with compassion and one that makes it easier to ask for help and easier to get it. Because mental health is health, and when we take care of it, our whole community is better off. Thank you, Deputy Speaker.
I call the member for Boothby.
Thank you, Deputy Speaker. Australia is in the midst of a mental health crisis and the statistics are stark. 1 in 2 Australian adults will suffer from a mental illness at some point in their lives. 3,000 Australians will take their own lives each year as a result of mental ill health. In South Australia, 1 in 5 people experience a mental illness every year, and 43% of South Australians will experience a mental illness in their lifetime. And while we wouldn't think twice about seeking professional care for a physical injury, too often we treat mental illness with an unseriousness that we wouldn't treat the common cold with. And that's why Mental Health Month is so important in bringing awareness to an issue which has for decades been under-prioritised when it comes to government support. I've worked in and around the mental health space all my life. I've run primary mental health services across South Australia, including rural and remote areas. I've run primary health services for SA Health in the city, as well as homelessness services for Catherine House and Vinnie's. And I've witnessed firsthand the emotional and financial toll that a mental illness can take on a person's life if the mental illness is left unchecked, untreated. The effects of mental ill health are felt far beyond the individual sufferer. It can have devastating impacts for the family and the community. The factors known to have a causative link to mental ill health are many and various, including unemployment, homelessness, financial insecurity, family and domestic violence, and significant life events. But a lack of accessible and affordable mental health services in the local community can mean a short-term episode becomes a long-term, serious, debilitating illness. Poor access to mental health services can be due to a range of issues: limited mental health workforce, continuing stigma around mental illness, a lack of collaboration across the different types of mental health services, an unequal concentration of mental health services in metropolitan areas to the detriment of regional and rural areas, and the high demand for mental health services where there is an undersupply of workers. But there is hope. Hope exists in a government that is prepared to take your mental health seriously. A government that is prepared to acknowledge the fact that a mentally unhealthy Australia means a socially and economically poorer Australia. A government that is prepared to support the most health vulnerable members of our community by making access to mental health services easier and more affordable. A government that will continue Labor's proud legacy of ensuring that healthcare and mental health care is a right and not a privilege. And that's why, as part of our Medicare plan, the Albanese Labor government has committed to investing an historic $1.1 billion to expand and enhance mental health services right across this country. The numbers speak for themselves: 91 Medicare mental health centres, 20 perinatal mental health centres, 17 Medicare mental health kids hubs, 203 headspaces. In my electorate of Boothby, we have a very well utilised headspace service, helping young Australians between the age of 12 and 25 navigate their mental health challenges. I visited there recently myself, and the staff do an absolutely excellent job, including one-off walk-in visits. In December this year, we will open a mental health kids hub in the Marion GP Plus Centre, providing crucial early intervention support and resources for children and their families. A Medicare mental health centre will be also established in Marion, providing a free walk-in service delivered by a multidisciplinary team. Work on a perinatal health centre is currently underway in Elizabeth in Northern Adelaide, and we're expecting at least one more in Adelaide as part of Labor's 2025 election commitment. And this will support mental health and wellbeing of mothers and families during and after their pregnancies, a particularly vulnerable time. These mental health services are in addition to the other facilities currently being built in Boothby. We have a statewide eating disorder centre, which will be established at the Repat Repat Hospital in Door Park at the very heart of Boothby, providing round-the-clock treatment for those living with an eating disorder and outpatient services. Now close to completion, we're rebuilding and expanding the inpatient mental health service at the Margaret Tobin Mental Health Centre at Flinders Medical Centre. When completed, it will be able to accommodate 48 mental health beds, including 12 brand new beds up in the psychiatric intensive care unit. The Albanese Labor government will also invest $500 million in 20 youth specialist care centres across the country to support young Australians with complex mental health needs, including personality disorders, eating disorders and early psychosis. This is part of the government's plan to fill what the experts have called the missing middle, ensuring that young Australians whose mental health issues warrant neither a GP visit or hospitalisation can also receive specialist care. On 1 January next year, the government will launch the National Early Intervention Service, which will provide over-the-phone and online support from trained mental health professionals for those with mild to moderate mental health services. It will be a free service, you won't need a referral, you won't have to pay a gap fee. And we're expecting this service will support around 150,000 people every year. The Albanese Labor government's historic $1.1 billion package to fund mental health services across this country reflects Labor's long-held commitment to an idea that the idea that an affordable and accessible public health service is for the benefit of all Australians and our community. Our expansion of mental health services under Medicare will relieve the pressure on subsidised private psychologists, allowing them to work more efficiently and effectively to support those with moderate to high mental health services. And to relieve this pressure further, the government will build up our mental health workforce by funding more than 4,000 psychology scholarships, internships and training places. This will mean more psychology places at universities and more training places for mental health professionals, including for psychiatrists, psychologists and peer workers. The government will also professionalise the peer workforce, establishing a new peer workforce association and undertaking a census of all peer workers. When I worked in mental health for the SA Health, we were the first implementing our peer workers, and it's great to see this important skilled workforce valued appropriately. They've proven to be invaluable in providing peer support and advocacy across a range of mental health settings. Significantly, from the 1st of November this year, the government will expand the eligibility for bulk billing incentives to all Medicare patients and will create an additional incentive payment for general practices that choose to fully bulk bill, because the GP is often the first point of contact for those seeking professional advice on a mental health issue. We aim for 9 out of 10 GP visits to be bulk billed by 2030. Mental health can be treated as a chronic disease, and GPs are a really important part of maintaining good mental health and preventing relapses, but only if they're affordable and only if the medications are affordable. The metaphor of the black dog is often invoked when speaking of depression, one of the most common mental illnesses in our community. The black dog is a companion who is extremely difficult to shake off. It can wake you up in the morning, it disturbs your sleep at night. It literally dogs your every move, casts a shadow on every activity, drains the joy, drains the energy, makes everything a little darker, a little greyer, a little more difficult. It craves your attention during the quieter moments of your day and barks even more loudly when it thinks your attention has strayed. We all have friends, family and colleagues, maybe even ourselves, who have been stalked by their own black dog. It's not easy, but it is possible to keep the black dog at bay. Many in our community live satisfying, productive lives managing mental illness as a chronic disease. And that's why the Albanese Labor government's groundbreaking investment in a national infrastructure of mental health care workforce and services is so vital. It will ensure that all Australians, no matter their age, no matter the severity of their condition, no matter their financial circumstances, are able to get the mental health support they need whenever they need it and wherever they need it. Thank you.
I call the member for Brisbane.
Thank you, Deputy Speaker. Now, mental health has touched many people, most likely everybody in this House, whether it's a friend, a loved one or even yourself. And there are many reasons why someone might struggle with mental health. It could be biological, genetics, family history, brain chemistry, structure. It could be psychological, trauma, stress, substance abuse, or it could be social and environmental, social isolation, life events, socio-economic, discrimination, or someone else's environment. Now, recently I spoke with Ariana, a 10-year-old student going to school in my electorate, and we chatted about mental health through the lens of school bullying. Now, she may be 10, but her observations were very wise and very mature. And while we chatted, she reiterated what she wrote in her winning Rise Our Voice submission, which I'll read out now. This goal, referring to stopping bullying in school, is so important because bullying does not just hurt in the moment, it can stay with a person for life. Many people in our community have experienced bullying, whether at school or online, and we must stop our young Australians from carrying that pain inside because it can lead to serious mental health issues, even suicide. ending bullying will help create a peaceful, loving and safe Australia for everyone. Wise words. While medications can help those struggling with their mental health, that's just part of the answer, and we still do need to lean in, as Ariana did, and question if there is something more to do. Deputy Speaker, our society has become less connected with one another. We have to question whether we're being driven more by social and environmental factors. It's actually human nature to want to feel connected and to feel part of something bigger than what we are. And as humans, we assign meaning to emotions and relationships that go well beyond an immediate experience. And we can feel a sense of belonging or connection through supportive relationships. But the rapid increase in technology and social media has meant more and more people are seeking that kind of interpersonal connection through our screens and less with each other, or, to use a young person's language, IRL, which means in real life. Now, I grew up in a household of 8 siblings, including foster kids, mum, dad, grandparents next door. We didn't have much, but being a family meant we always had each other and we had our community. And now we have an entire generation who didn't grow up knowing what it was like to ride your bike around for hours, to go to the local park and kick a footy, climb a tree, drop in on a friend unannounced, because let's face it, that's what was available to us and we made our own fun. But we do live in different times, and we know mental health challenges affect many in our community. In fact, a recent Australian Institute of Health and Welfare study showed that 1 in 5 Australians aged 16 to 85 experience a mental disorder. 3.4 million experience anxiety, that's 17%, and 1 in 7 children and adolescents experience the mental illness. Now, as a government, we have a responsibility to provide tools and support to give people the help when they need it most. And that's why I'm really proud to be part of a government that not only recognises this responsibility, but is backing it up with necessary resources and funding. This government is putting mental health at the heart of Medicare and delivering more services in the centre of communities across Australia, boosted by our historic $1.1 billion in mental health and election commitment. Now, over the coming years, we will see new expanded Medicare mental health centres, headspace services, Medicare mental health kids hubs, perinatal mental health centres and youth specialist centres. Very broad-ranging. We've already delivered 45 mental health centres, 172 health headspace services, 11 Medicare mental health kids hubs and 10 perinatal mental health centres. Now, during the election campaign, I talked obviously to a lot of the voters, and one of the biggest issues raised with me was lack of access to affordable mental health. And that's why I was so pleased to join Assistant Minister for Mental Health and Suicide Prevention recently to open the new Medicare Mental Health Centre in Lutwyche. Now, this centre provides a safe and very welcoming place for anyone to access free, quality mental health care and over extended hours. It's staffed by a team of highly qualified mental health professionals and, importantly, people with lived experience of mental health. They will listen and work with you. They'll listen and work with those in my community, providing them with the care and support they need. And the support through this centre, again, is free for everyone who walks in the door. You don't need an appointment or a GP referral. You can walk in, get access to free mental health support without the need of an appointment, without the need for a referral and without the need for a mental health treatment plan. The centre, as I mentioned, is staffed by multidisciplinary teams, including mental health clinicians for when they're needed and peer support workers. And it's vitally important to provide places for people to feel safe, where they can get the support they need. And as a government, though, we also do need to look at the negative impacts of social media and bullying that's leading to some of this increase in demand. The rise of social media addiction is at pandemic levels, and it not only impacts our society as a whole, but the younger generation. And that's why it was so important that this government had the guts to take on the big tech companies and the social media giants to introduce the world's first ban on social media for those under 16. Now, the eSafety Commission's recent Keeping Kids Safe Online survey explores the benefits but also highlighted the risks of the online world to children in Australia. Some telling statistics. Almost 3 in 4 children had seen or heard content associated with harm online. more than 1 in 2 had experienced cyberbullying. 3 in 5 had seen or heard online hate, while over 1 in 4 had personally experienced it. 1 in 4 had experienced non-consensual tracking, monitoring and harassment. The prevalence of online harm varied by gender and age, with teens and trans and gender-diverse children generally more at risk. Deputy Speaker, we want kids to know who they are before the platforms assume who they are, and the new laws that ban social media for those under 16 give an integral buffer that allows kids to do just that. It will save lives because, as the Minister said, while we can't control the ocean, we can police the sharks. And these laws, starting in approximately 2 weeks on December 10, will save the lives of Australian kids. We know there will be kids and others who will try to get around them. It happened when we introduced the alcohol ban, but we persisted with that. It's about a cultural shift too. And that's why I also thought it was important to organise a local social media forum in Brisbane to discuss the upcoming changes with parents and provide them with tools and resources to navigate it. We brought together some experts, Paul from the eSafety Commission and Professor Alina Morawska, who's the Director of Parenting and Planning and Family Support at the Queensland University. Their insights on how these laws worked were very helpful. They provided practical tips for parents and carers. And I really do congratulate those who came along to hear what those experts had to say. Deputy Speaker, when we think about who we are, we have Maslow's hierarchy of human needs. It's a psychological theory that outlines 5 levels of human needs. According to this theory, individuals must satisfy those lower levels, food, shelter, security, health, before we can even think about fulfilling ones like friendship, love, etc. And as a government, we're playing our part to try and address some of the fundamentals: affordable housing, being able to see a GP for free, cheaper medicines, 20% off student debt. But let's face it, there is a loneliness epidemic in our society, and we all have the power to change that. I want people out there to know you are not alone, and no matter who and where you are, you deserve to be happy. Everywhere we look, we see people glued to their phones, almost hypnotised, waiting for the next thumbs up emoji or that red heart emoji, an instant response. But the reality is it's not providing our communities and each of us with genuine connections. It's harming our mental health. We need as a society, I believe, to take back control on what it means to feel connected and to be happy. Are we really going to wake up one day when we're much older and say, I wish I spent more time on my phone or online? Or are we going to think about, we took that chance, we're going to spend more time with our loved ones, join that community or sporting group that's been on the to-do list forever, go to that party, read a good book, have a good boogie lit to to your favourite song, or just simply smile at that person you don't know. You might just change your life for the better, and you might just change someone else's in the process.
I call the member for Maribyrnong. No? Braddon. I beg your pardon. I call the member for Braddon.
Speaker. October was Mental Health Month, a time to reflect and to raise awareness on the well-being of every Australian. It's a time to speak openly and to listen deeply and to act with compassion. And in my electorate of Braddon, we have a powerful reason to celebrate. We just marked a major milestone for mental health care in our region with the official opening, alongside Assistant Minister Emma McBride, of the new Medicare Mental Health Centre in Devonport. This isn't just another health facility, it's a lifeline, a place where people in distress can walk through the door and find support without barriers, without judgment and without delay. For too long, mental health support has been out of reach for many Tasmanians, particularly in our regional areas. We've heard the stories, long wait times, referral requirements and those cost barriers. People struggling in silence, unsure where to turn or unable to afford the help that they need. That's not good enough, and it's not the kind of Australia we want to build. The Devonport Medicare Mental Health Centre changes that. It offers free walk-in support, no appointment, no referral, no treatment plan required, just help when and where it's needed most. The model of care is built around the individual. It's staffed by a team of clinicians and peer workers, people with both professional expertise and lived experience, Together, they provide support that is compassionate, timely and tailored to each person's needs. Whether someone is experiencing a crisis or seeking ongoing care, the centre is ready to respond. It's a safe space, a welcoming space, and a place where people are seen, heard and supported. I'm proud to say that we'll take a major step forward soon with the opening of a new Medicare Mental Health Centre in Burnie. This centre will join the growing network of Medicare mental health centres across Australia, designed to fill critical gaps in the mental health system and reduce that pressure on our hospital emergency departments. Its establishment reflects the Albanese Labor Government's commitment to delivering accessible, community-based mental health support, particularly in regional areas like Braddon. This is deeply personal for our community. We've seen the toll that mental distress can take, especially in our regional areas where services are limited, but that stigma still lingers because of our small communities. We know that mental health doesn't discriminate. It affects young people, parents, older Australians, workers, carers. It actually affects all of us. And we know that when people reach out for help, they deserve to find it close to home. Across the country, the Albanese Government is delivering more mental health services right in the heart of our communities. As part of our plan to strengthen Medicare, we've made an historic $1.1 billion commitment to expand mental health services across the whole lifespan. This includes 91 Medicare mental health centres offering that free walk-in care from a multidisciplinary team. And as I said, we've got one in Devonport and really excited that we'll be opening one very soon in Burnie. 20 perinatal mental health centres supporting new and expectant parents, 17 Medicare mental health kids hubs, helping children and families with behavioural, emotional and social wellbeing, and 203 Headspace services supporting young people aged 12 to 15. And we have an expanded mental health service, Headspace service right in Burnie. And we're not stopping there. We're investing an additional $72.7 million to boost Headspace services right across the nation, giving our young Australians quicker access to the free mental health support that they need when they need it. This funding will add more staff to meet growing demand, expand individual and group therapies, improve infrastructure to create safe, welcoming spaces. And I found that really important in terms of the Medicare Health Hub in Devonport, where when you walked in you felt a really relaxing, calm environment, and that's really important, particularly for young people. And it will also enhance inclusive support for First Nations youth, for LGBTIQA plus individuals and our CALD communities. And I'm especially proud to say that Burnie will be the home to one of those 30 Headspace services that I talked about being uplifted to a Headspace Plus, providing enhanced care for young people experiencing severe mental health right in our community. They don't have to travel. It's a really difficult time for young people with mental health issues to then be able to find the care that they need right in their own community, and that's what this delivers. And we know that regional communities need to be able to access services, and expanding those facilities in Burnie will mean much more support for young people aged 12 to 25 right where it's needed most. And I've sat down with the health and support people in the Burnie health space, and they are excited about reaching out broader than Burnie right across the community of Braddon, so I'm excited about that. And from early next year, we'll also roll out a national early intervention service, providing free phone and online support from trained professionals, and that's expected to help more than 150,000 Australians each year. So we are layering the assistance that people can actually walk into or get on the phone to, and they can get the service they need without long waiting lists. We're also investing in the workforce, and that makes this care possible. And without those fantastic health workers in this area, we just can't do the sort of things that we want to do. So we're investing in that workforce with over 4,000 psychology scholarships, internships and training places, and new support to professionalise the peer workforce. Because we value that lived experience, And when we opened the Medicare mental health clinic in Devonport recently, I met a fabulous support worker who had lived experience, and I think that makes the journey for someone with a mental health condition much easier if they can actually speak to someone who has had that lived experience as well. And we know that peer workers bring something powerful to the table: empathy, understanding, which then provides hope for those people. Next year we'll establish a peer workforce association and conduct a national census of peer workers to better support and grow this vital part of our mental health system, to provide that support that those workers need. And as we expand the range of free services, we're making it easier for Australians to find that right support. The Medicare mental health phone line is 1800 595 212, and the website medicarementalhealth.gov.au are there to help people connect with the care that they need. It's a phone call, tap on a website, and you've got the help that you need. You can go and find it and navigate through. Mental Health Month reminds us that wellbeing is not a luxury, it is a right. And with every new centre, every new service and every new conversation, we're building a stronger, more compassionate Australia. But we should also say every day is a chance to look after ours and others' mental health, not just for the month of October, but to do it all year round. Thank you.
I call the member for Maribyrnong.
Thank you, Deputy Speaker. October was Mental Health Month, a time to remind ourselves that mental health touches every part of our lives. It's a part of every family, friendship and community. This year's theme, Taking Steps on Our Wellbeing Journey, is such an important reminder that mental health isn't about one big moment. It's about the small steps we take, the conversations we start, the habits we build and the support we reach out for along the way. And those steps look different for different people. For some, it's finally talking to a mate. For others, it's showing up at a men's shed or calling help Lifeline, or accessing services like Headspace. Every step counts, and every step forward deserves to be recognised. We all know someone who has struggled: a friend, a colleague, a neighbour, or perhaps even ourselves. For too long, mental health has been seriously stigmatised. But the reality is mental health is health. It deserves the same care, attention and compassion we give to every other part of our wellbeing. Mental Health Month is about starting conversations, but more importantly, it's about continuing them. It's about building communities where people feel supported all year round, where taking the first step, or the next one, is seen as an act of strength. Deputy Speaker, recently I visited two of some fantastic men's sheds in my community, Strathmore and Moonee Ponds. They are two remarkable groups that are supporting men's mental health. Men's sheds are more than workshops, they are places of belonging, where conversations happen naturally over the workbench and friendships are formed with shared purpose. For too many men, especially older men, loneliness can creep in silently. Work ends, routines change, loved ones are lost, and suddenly the days get quieter. Social isolation is a major risk factor for poor mental health, and men's sheds tackle that head on. They offer connection, purpose and mateship, often in ways that feel natural and safe. I'm proud that the Albanese Labor government continues to support men's sheds. We recognise that connection and prevention start in local halls, community groups and sheds just like these. Deputy Speaker, I've also had the recent opportunity to meet with the new CEO of Lifeline, Graham Strong. Lifeline has been answering calls from Australians in crisis for more than 60 years, offering compassion, understanding and hope. Each call is a chance to save a life. It takes extraordinary dedication to listen, care and help someone see a way forward. The volunteers and staff of Lifeline are the quiet heroes of our mental health system, and their work deserves recognition and support. Deputy Speaker, in Maribyrnong, the Albanese Labor government is boosting access to vital mental health services with a $6.2 million investment to open a new Headspace in Moonee Valley. I've spoken about this project a lot, and I will keep speaking about it because it's such an exciting and important initiative for my community. Headspaces provide free wraparound support for young people aged 12 to 25, covering mental health, physical health, alcohol and drug support, and study and work pathways. As a qualified child and youth psychologist, I know how powerful early support can be. Giving young people help before the challenges escalate can really transform years of silent struggle into a chance to thrive. This new centre is part of the Albanese Labor government's $1 billion investment to expand free public mental health care through Medicare, making it more easier than ever before for Australians to get the support they need when they need it. Deputy Speaker, I recently caught up with our local primary health network to get an update on where things are at, and it's coming along quickly. They let me know that more updates will be coming in the coming months and that the process is moving along swiftly. And I'm keen to keep my community in the loop every step of the way. Young people in Moonee Valley have been waiting far too long for this service, and I'm determined to see it delivered as quickly as possible. Deputy Speaker, I also want to touch on the government's work to protect young people online. We cannot talk about mental health without talking about the impact social media is having on our kids. I recently held a social media forum with Minister Wells for local parents and teachers in my community. We heard powerful stories from two bright young students in my community about why these social reform changes are necessary. Natasha spoke about how social media has begun shaping her identity long before she even knew who she was. How the constant comparison, the created perfection and targeted content left her feeling smaller, not stronger. And Hayden spoke honestly about what many young men are experiencing, platforms deliberately targeting their insecurities, pulling them into toxic, hypermasculine content without them even realising it. Deputy Speaker, these aren't isolated stories. They're happening in homes, classrooms and playgrounds across Australia. Social media platforms are designed to be addictive. They feed insecurity, they amplify anxiety, they expose kids to content they simply aren't ready to navigate. That's why the Albanese Labor government is introducing world-leading minimum age reforms for social media accounts, giving kids a crucial additional 36 months more before they're thrown into the online world, so that can profoundly shape their self-esteem, their relationships and their mental health. This is about giving young people the time to build resilience and real-world connections first, about giving parents some peace of mind that the algorithm isn't raising their children. And it's about putting responsibility back into the platforms that have profited from our children's attention without keeping them safe. Deputy Speaker, we can't outparent an algorithm and kids can't outwit one. These reforms help give young people, including Natasha and Hayden, a better chance to grow, learn and thrive offline before placing the pressures online. Deputy Speaker, we know our mental health system has some deep structural problems. We know the workforce shortage is real. And we know reform won't happen overnight. But just like we're doing with Medicare, with housing, climate action, we're getting on with the job and fixing what's been broken for too long. Reforming mental health care isn't something you can fix in a single budget or with one announcement. It takes time, coordination and genuine partnerships across government with workforce and, most importantly, with people who have lived experience. We're continuing to build a mental health system that is public, coordinated and fair, a system that backs early intervention and supports the workforce and makes sure care actually reaches the people who need it. Our $1 billion investment will deliver 31 new upgraded Medicare mental health centres, 20 new youth specialist care centres, 8 new perinatal mental health centres, and we're creating 1,200 new training places for clinicians and peer workers, because none of this works without the people who deliver the care. On top of that, we've committed an additional $361 million through our Stronger Medicare, and including $163 million for a new national intervention service that anyone can access for free. Our government is committed to getting this right for the long term. Deputy Speaker, we also can't talk about mental health without talking about suicide. As a co-chair for the Parliamentary Friends of Suicide Prevention, I co-hosted an event in September to mark World Suicide Prevention Day. We heard from Suicide Prevention Australia's leadership and from Alicia Montford, who turned her family's tragedy into advocacy and hope for others. Her story reminded us that behind every statistic is a person, a life lost, a family grieving, a community forever changed. The Albanese Labor government's National Suicide Prevention Strategy takes a whole-of-government, whole-of-society approach, tackling health, economic and social drivers of distress. Listening to lived experience must remain at the heart of policy and service delivery. And earlier today, Deputy Speaker, I attended a briefing from Dr Alex Haynes, the head of the National Suicide Prevention Office. He walked us through the new National Suicide Prevention Strategy and the early development of the National Suicide Prevention Outcomes Framework, the tool that will help us understand what's working, where the gaps are and where support needs to go. It's evidence-based, compassionate reform and exactly the direction we need to be heading. Deputy Speaker, Mental Health Month and its theme of taking steps on your wellbeing journey is a reminder that mental health wellbeing touches every part of our lives. It is about compassion, community and connection. It's about recognising every step, big or small, that someone takes to look after their mental health. It's about building a country where no one feels ashamed to ask for help and where care is available when and where it's needed. The Albanese government is investing in reform, but the heart of this work lives in our communities, in our Lifeline volunteers, in our men's sheds, in our mental health workforce and in the courage of those who share their stories. So as we head towards the end of our parliamentary year, let's keep taking those steps. Let's keep the conversation going. Let's reach out, listen and support each other because mental health is everyone's business and together we can make sure no one faces it alone.
I call the member for Ford.
Thank you, Deputy Speaker. I spoke on this yesterday in the Federation Chamber, but I think a longer speech gives me the opportunity to go into this in a little bit more detail. So, on a light note, the moustache, which I'm now proudly displaying, is I think 26 days old. Which actually, thanks to my friend next to me, the member for Hunter, has encouraged me to raise awareness and funds for men's health, but particularly men's mental health. And I'm not sure that, in fact, I think if the camera were able to look around this chamber, the three of us are sporting that because it's important that. Guys that don't really normally like to talk about their own health or their own situation feel encouraged to do so. And really my own experience with mental health is I guess informed about where I grew up. I have the great privilege of representing the electorate of Ford now in the southern in Logan and in the northern suburbs of the Gold Coast, but I'm a Broken Hill boy at heart, a country boy, and Broken Hill, a mining town like Gladstone, a mining city actually, where it is working class to its bootstraps, and where the men and women out there are tough and hard-working and soul to the earth, everything that you expect about Australians when you think about Australians. And the men are just tough, working-class men. And even though it's 1,400 kilometres or so away from where I live now, even though the geography is different, the demography is the same. That people in Ford are tough, working-class people, trying to do their best, trying to get ahead, and putting themselves last. So often, the men and the women. But growing up in Broken Hill, I just think of two guys who would be my age today if they were still around, but they're not still around. And it's been a long time since I've been back to talk to their families, so I won't use their last names, but I'll use their first names, and anybody who knows who I'm talking about will know them. Benny and Billy. Benny and Jezza. Benny was just this magnetic kid with this cheeky smile. And when I got involved in politics, got interested in politics as a young person, the New South Wales government had come to power and was cutting education. This is back in 1988. And all of us who are really aware of what was going on in politics, were getting really outraged, and somehow we managed to foment a school strike. And I can remember Benny was one of the people really encouraging me to lead the strike. Benny couldn't care less about politics. The last thing Benny was interested in was what was going on with student-teacher ratios. Benny wanted a day off. But Benny was just this tough kid with this natural gravitas that attracted people to him. And it was because of Benny getting behind me and pushing me that really, you know, him and I marched up to the principal and announced that we were going to have the school strike. Well, for me it was a school strike, for Benny it was the day off. But Benny was just this amazing character. Jezza, from the same group, we're all sort of Southies in Broken Hill. Jezza, different kind of guy. Really, you know, if you didn't know him real well, he was just this sort of quiet, gentle bloke. But geez, he loved to laugh, and geez, he was the sort of mate that you would just go into the trenches with. And despite how good they were, they took their own lives. And they are not uncommon in working class communities, and not uncommon amongst men. In many ways, the only thing worse than talking about suicide is not talking about suicide. And the reason why it's so important to look at the impact that it has on men is that something like 75% of suicides are men. And as much as it is a men's issue, the people who bring it up with us when we're going around in our communities are generally the mums and the wives and the daughters who are concerned about their man's mental health, because men are usually the ones least likely to bring it up themselves. And so it is so important on us as a parliament to do what we can as leaders in our community, but also collectively, to shine a light on the scourge that is male mental illness. There's a lot of reasons for why it might happen. I think growing up in the 80s, Australia was a much more egalitarian country. We were more equal. There was this commitment, I think, to mateship that you don't hear a lot of these days. And I think that as we became, through the 80s, through economic rationalism, through privatisation, through a chasing of the dollar rather than of community, we moved away from that spirit of doing things that for the sake of other people. And we've been left poorer as a society for that approach to economics. And when I'm talking to young people today, one of the reasons that they cite for their mental health is, I mean, look at it. Look at the state of housing, and it's bad enough when we see it. But imagine trying to grow up in a world where this is the world that you're going to come into after high school. So it's tough on kids, and it's tough for other reasons too. One of the things that I for some reason had a look at was pastoral commissions, and there was a Royal Commission into television back in the 1950s that was looking at whether or not there would be multiple stations, whether there would be one government-owned station, whether a television would run 24 hours a day, whether people would pay for licences, etc., etc. And one of the submissions that went into that Royal Commission was that television would destroy communities, and in many ways they did. Television took people away from those community experiences and stuck us in lounge rooms gathered around the box. But social media has done that on steroids. So you look back at television now, at least there was some shared experience. Now we are completely chopped up into little tiny slices in our bedrooms, separated from family, separated from community, all getting some sort of message through social media. The stress that this puts on young people and older people as well has got to be one of the reasons that mental health is so bad, such an epidemic in our community. But I think that despite the problems that exist, and the problems that in many ways are getting worse, there are real solutions that are out there. So, and I think the best example of that would be Mates in Construction. That's, for those that I'm sure know it is started somewhere around 2007, where suicide rates amongst male construction workers was way above the community average. But because of the work that they've done, they've managed to bring suicide rates down to about the community average amongst male construction workers, and the way that they're going, it's going to be less than the average the less than the national average. So something is going on. So they are doing something right, and so often it is just one conversation that makes all the difference. It is just a few sessions with a trained professional that makes all the difference. And without giving somebody, though, without having that one conversation, without putting somebody in the right direction, that not having that conversation can have catastrophic consequences for the individual and catastrophic consequences for the family. There's so much more to do. The moustache will be coming off on 1st of December, but the work will continue, and I say led by lucky to have today the special envoy for men's health, led by a position with the first time that it exists in the Commonwealth.
The member's time has expired. I call the member for Hunter.
Thank you, Speaker. I rise today to speak about Mental Health Month, and in particular the mental health of Australian men. This is an issue that cuts across every part of our society. It affects every community, every workplace and every family. No matter where you live, what work you do or what your background is, every community in this country has men who are doing it tough, often without saying a word. The truth is simple, Speaker, and it's also very, very confronting. Australian men are struggling with their mental health, and too often they are struggling in silence and also in isolation. Last year alone, 2,529 Australian men died by suicide. That is more than 3/4 of all suicides in our nation. For men aged 15 to 44, suicide remains a leading cause of death. It's ahead of accidents, it's ahead of diseases, and it's ahead of anything else. It's an enormous and preventable loss that should give us all the time to pause and reflect on these horrifying stats. Because behind each and every one of those numbers is a real life. A father, a son, a brother, a mate, a co-worker, a neighbour. When a man dies by suicide, it never just affects one person. Families carry that grief for years and years and years. Children grow up without their dads. Partners lose the person they planned a life with. Mates feel shock, guilt and heartbreak. Communities feel the loss deeply, often for generations. And despite this enormous burden, men remain far more likely to not seek any help. Only around 1/3 of men experiencing mental health condition saw a health professional last year. Many waited weeks or even months before reaching out, and tragically, some never reached out at all. But part of the challenges is that men often show signs of mental ill health in ways that can easily be misunderstood. For many men, poor mental health does not always include and look like sadness. It may come out in anger, in frustration, disengagement, drinking more than usual, withdrawing from mates, losing interest in activities they once enjoyed and loved, changes in behaviour at work, or physical symptoms such as headaches, insomnia and ongoing stomach pain. These signs can easily be overlooked, Speaker, not because people don't care but because men themselves have grown up believing they should hide emotions and suppress vulnerability and simply soldier on. For generations, Australian men have been taught directly and indirectly that expressing emotion is a weakness, that asking for help is embarrassing, and that suffering in silence is the strong thing that people should do. This old stereotype is costing lives in this country. The risks are even higher in male-dominated industries such as construction, mining, transport, agriculture, emergency services, defence and fly-in, fly-out workforces. These industries come with long hours, isolation, physical strain, high-pressure environments and irregular shifts that disrupt routines and relationships. Many men in these sectors feel significant pressure to push through and avoid being seen as a burden or a problem. I've spoken to miners who took 2 weeks on, who work 2 weeks on and 1 week off, who feel completely disconnected from their families. I've spoken to farmers who carry enormous financial pressures and weight of generational expectations. I've spoken to tradies who will not mention how they're feeling on site because they do not want to make things awkward on site. These experiences are real and they are far more common than many people realise. This is why addressing men's mental health requires a whole lot of community effort, and that is why the Australian Government continues to invest significantly in mental health services, prevention and support. This year, around $7.8 billion is supporting mental health services, suicide prevention initiatives, digital programs and growth of strong mental health workforce. Through strengthening Medicare, more than $1 billion is helping Australians, especially young people, access support earlier and more easily. That includes expanding bulk billing incentives, more affordable psychology and support that meets people where they are. Importantly, these programs are designed specifically for men because we know that one-size-fits-all approach does not work. The men's table gives men a safe, structured and confident place to talk openly with other men. Mates in construction, mates in energy, mates in manufacturing provide practical support for workers in high-risk industries. These programs save lives not just by offering professional help, but by building cultures where it is normal to check in on your mates. Dads in distress assist separated fathers who feel like they are often isolated and unsure where to turn. Dad Booster provides online support for new fathers navigating the huge transition into parenthood. SMS for Dads, developed by the University of Newcastle, sends out simple but powerful messages to new dads, reminding them they are not alone and providing guidance during the early and often overwhelming months of fatherhood. First Nations men who face suicide rates around 3 times higher than non-Indigenous men. Culturally safe services like Brother to Brother and 1-3 Yarn are absolutely vital. These services are run by Aboriginal and Torres Strait Islanders peoples and Aboriginal and Torres Strait Islander people. They recognise the importance of culture, community and connection in healing. The National Aboriginal and Torres Strait Islander Suicide Prevention Strategy, designed with strong community leadership, supports long-term change and local self-determined solutions. But, Deputy Speaker, as important as funding and programs are, they alone cannot overcome the biggest barrier, which is unfortunately stigma. Stigma around mental health, stigma around seeking help, stigma around what it means to be a man. Too many men still believe that asking for support shows weakness. Too many fear being judged. Too many think they will be letting their families down if they admit they are struggling. But in truth, speaking up is a sign of strength and a sign of responsibility and courage. Every Australian can play a part in breaking down that stigma. Movember promotes a simple and effective method called ALEC. Ask, listen, encourage action and check in. Ask a mate how he is really going. Listen carefully without rushing to fix or judge. Encourage actions such as talking to a GP, calling a support service or opening up to somebody close. And check in again later, because one conversation is not the beginning, it's just a beginning, not an end. These small moments all matter. These conversations save lives. Workplaces can do even more by encouraging open discussions, providing mental health training, offering flexible work arrangements, building supportive environments and promoting early intervention. Employers can help reduce risk and create healthy cultures. Workplaces that value mental health do not just protect workers, they build stronger, safer and more productive teams. Our communities also play a powerful role. When men feel connected to family, friends, culture or community, they are healthier and safer. When men feel isolated, unconnected or ashamed, their risks increase significantly. Strengthening social connection through sport, volunteering, culture, clubs, men's sheds or community groups is often one of the most effective ways to protect men's well-being. Men themselves can also take practical steps to protect their mental health. Sleeping well, eating well, staying active, limiting alcohol, spending more time with mates, reconnecting with hobbies, reaching out early when something feels wrong, and get the help to build resilience, balance and well-being. But when things get tough, support is always available. Lifeline, Beyond Blue, Men's Line, the Suicide Callback Service, 1300 Yarn, Kids Helpline and Headspace are ready to assist any hour for any reason. These services provide confidential and non-judgmental support, and we need to make sure we keep getting people to reach out to that. Deputy Speaker, Mental Health Month is not just a date on the calendar, it is something that should be looked at every day of the week. And I urge every male out there to make sure that you are looking after your health. You are looking after your mental health the best you can, because mental health and physical health come hand in hand. If we're struggling, we need to be talking to our GPs. Get out, see your GP. Do yourself a favour on your birthday. Book in an appointment with your GP, make it normal to see them, get a blood test and talk about your mental health. If you are struggling, reach out because help is available. Please make sure you do it. And remember, it's not weak to speak. Thank you.
I call the member for Dunkley.
Deputy Speaker, and to my fellow colleague Dan Rapicoli, the member for Hunter and the Special Men's Health Envoy. November marks Mental Health Month, a time when we pause, reflect and confront one of the most pervasive and often unseen challenges affecting Australians today. We know that 42.9% of Australians aged 16 to 85 have experienced a mental health issue. Nearly half of us. Half of our families, our workplaces, our communities. This is not an issue that sits at the fringes of society. It touches almost everyone's home in this country. In 2024 alone, 3,307 Australians died by suicide. That is 9 people, a sporting team worth of lives lost every single day. Behind every one of those numbers is a family with an empty seat at the dinner table, a school with a chair that will never be filled, and a workplace hoping for a colleague who will not walk back through those doors. More than 7 million Australians are close to someone who has died by suicide or attempted to take their own life. And by the age of 25, 1 in 2 young people will have been personally affected. Deputy Speaker, these are not statistics. These are stories, these are families, these are lives. Mental health shapes every aspect of a person's life. It determines whether they can finish school, maintain relationships, secure stable housing, keep a job, or imagine a future they feel hopeful about. Australia is in the midst of a suicide crisis, and for too long, too many years, the responsibility for navigating a fragmented system has fallen on those already struggling. Deputy Speaker, my commitment to mental health does not come from theory or politics. It comes from lived experience and from more than 20 years working alongside young people, families and frontline workers in the community sector. At Anglicare, at Family Life and with the Women's Spirit. I saw both the extraordinary strength people possess and the pain that arises when they reach for help and find long wait lists, confusion or even silence. I have sat with young people exhausted from carrying burdens they didn't have the words for or felt too ashamed to mention. I spoke with parents about their desperate need to help their children but not knowing how to navigate the system. I have worked shoulder to shoulder with frontline workers, youth workers, counsellors, case managers, people who show up every day and give everything despite feeling overwhelmed. and I grew up in a family that faced its own challenges. I know what trauma feels like, what recovery requires, and what it means when someone steps in early and believes in you before you slip too far through the cracks. These experiences shaped who I am and being here now. They shaped the way I listen, advocate and fight for reform, and they taught me two truths that guide every decision I make. Early intervention saves lives. Community support changes them. When a young person gets help at 14 instead of 24, their life changes. When a family is supported, not judged, their hope grows. When a community wraps around someone, their chance of surviving and thriving increases. This is why mental health is deeply personal to me, and why I will always use my voice to push for the change our communities need. I am proud to stand as part of the Albanese Labor government with my colleague, the member for Hunter, a government acting with urgency, compassion and a focus on early intervention. Since coming to office, we have invested $2.4 billion in mental health and suicide prevention. This includes $225 million for 31 new upgraded Medicare mental health hubs, $500 million for 20 youth specialist care centres, $90 million to train more than 1,200 mental health professionals, $200 million to upgrade or expand 58 Headspace centres, including $1.2 million for Headspace in Dunkley. This investment means young people in Dunkley will no longer face months-long wait lists. It means more early intervention, more crisis support and more services delivered close to home. And while these investments are significant, they are the beginning, not the end, of building a stronger, fairer, more accessible mental health system. One of the most meaningful moments this year was hosting the Dunkley Men's Health and Wellbeing Forum with the Special Envoy for Men's Health, the member for Hunter, on the 12th of November. Around 70 men, boys and organisations joined us, supported by the Man Cave, Movember, and the Frankston Dolphins Football Club. It was a room filled with honesty and hope. It was also special for my family. My husband Dave and our son Flynn emceed the event. Flynn spoke with courage about growing up as a young man today, the pressure to be perfect, the weight of expectation and comparison, the pull of social media. His openness reminded us that young men want to talk. They just need safe places to do so. The member for Hunter shared important insights about prostate health, body image, mental health, and the courage required to ask for help in a society that tells men to tough it out. What stayed with me most was the willingness of men, teenagers and retirees to speak with honesty and vulnerability. No bravado, no judgment, just connection. From that night, that event, came something powerful, a commitment to form a Dunkley Men's Health Network, a community-led initiative dedicated to connection, prevention and ensuring no man or boy feels they must face hardship alone. I will continue supporting this work wholeheartedly. A week later, I attended the Governor-General's residence for an International Men's Day event recognising the Man Cave, an organisation with deep roots in Dunkley. Their first program was delivered at Frankston High School in 2014. 10 years on, they have supported more than 100,000 boys and young men across Australia. Their work builds emotional literacy, resilience, respect and healthy masculinity. It challenges outdated ideas that tell boys to stay silent or suppress emotions. Deputy Speaker, mental health cannot be solved by government alone. Leadership matters, investment matters, but mental health is ultimately a shared responsibility. We need to keep listening to young people, families, frontline workers and people with lived experience. We need systems built on early intervention, not shame and genuine accessibility for all. Deputy Speaker, I'm proud of the steps we are taking nationally and locally, but the work is far from finished. Every life touched by a mental illness, health matters. Every family grieving a suicide matters. Every young person searching for hope matters. I will continue to work every day to ensure our community is seen, heard and supported, and that our mental health system reflects the dignity every person deserves. Thank you, Deputy Speaker.
It being 1:30, the Federation Chamber stands suspended until the chair is resumed at 4 p.m.
Honourable members, are there any further statements on Mental Health Month? And I give the call to the member for Aston.
Thank you, Deputy Speaker. The month of October was Mental Health Month, and the Albanese Labor Government is delivering more mental health services in the heart of communities right across the country. As part of our government's plan to strengthen Medicare, we made an historic $1.1 billion commitment at this year's election to deliver new and expanded mental health services that support Australians across every stage of life. As a government, we are establishing 91 Medicare mental health centres, offering free walk-in care from multidisciplinary teams. Our government is also creating 20 perinatal mental health centres to deliver tailored support for new and expectant parents, and 17 Medicare mental health kids hubs to provide children and their families with the behavioural, social, emotional and wellbeing support they need. For young people aged 12 to 25, 203 Headspace services across the country continue to play a vital role in supporting their mental health and wellbeing. Additionally, as part of the Albanese Labor Government's recent election commitment, Headspace Knox in my electorate of Aston will be uplifted to a Headspace Plus, demonstrating the deep understanding that this government has regarding the growing need and complexity of youth mental health. Headspace Knox offers young people in my community aged 12 to 25 a welcoming environment where they can access confidential and free mental health support, health advice and general information. From early next year, we will also roll out a new national early intervention service, providing free mental health phone and online support from trained professionals. This service is expected to reach more than 150,000 Australians every year, helping people access care early before their challenges become a crisis. By expanding access to free public mental health services that meet different levels of need, our initiatives will relieve pressure on subsidised private psychology services, thus making it easier for people to get the right care when and where they need it. Furthermore, our government is investing in the future of the mental health workforce, with more than 4,000 psychology scholarships, internships and training places to ensure we have the skilled professionals required to deliver these services across the nation. Importantly, we are recognising and supporting the invaluable contribution of people with lived experiences. We are professionalising the peer workforce, establishing a new peer workforce association next year and conducting a national census to better understand and strengthen this vital part of our mental health system. And on a personal note, I have my own lived experience of requiring mental health support back in November 2001, when my firstborn baby boy, Clancy, was around 4 months old. I had not been feeling myself for some time but couldn't figure out why. My new little bub, Clancy, was a dream. He slept soundly. He wasn't much of a crier. He breastfed beautifully and I bonded so strongly with him. On that level, we were doing very well as new mum and bub, but I couldn't sleep. My mind was racing. I was no longer interested in socialising or doing all the things that used to bring me joy. On one of my visits to the maternal child health nurse in my local area, she gently asked me some questions. How was I feeling? Was I getting out to see friends and family and so on? And then she got me to fill out a questionnaire, and as it turned out, I was subsequently diagnosed with postnatal depression. It had never occurred to me during those first few months of motherhood. In my naivety, I figured only mums with babies who didn't sleep or who cried all the time only got postnatal depression. But PND can happen to any mum, and it can happen to new mums, or it can strike you when you've had your second baby or any other baby after that.
I was very fortunate to have had the mental health support I needed at that time and was able to get through that challenging time in my life. Deputy Speaker, every Australian deserves access to compassionate, quality mental health care no matter where they live, their background or their circumstances. We know that mental health challenges can affect anyone at any stage of life, just as it affected me 24 years ago. These investments are about meeting people where they are, providing support before crisis strikes and ensuring that no one face their struggles alone. Behind every policy and every program is a person, be they a parent, a child, a young person, a friend or neighbour who deserves to be heard, supported and valued. When someone reaches out for help, they are showing courage, not weakness. Our responsibility is to meet that courage with care, to replace stigma and with understanding, and to ensure that hope is never out of reach. And let us be clear, this is not just about services or statistics. It is about building a culture of compassion. It is about communities that lift each other up, workplaces that nurture well-being, and schools that teach our children that it is okay to ask for help. It is about ensuring that mental health care is not a privilege, but a fundamental right for every Australian. We know that when mental health is supported, everything else follows. Families grow stronger, communities become safer, and our economy thrives because people can reach their potential. Mental well-being is not just a health issue. It is a foundation for opportunity, equality and national prosperity. This government understands that when we invest in people's minds and hearts, we invest in the future of our country. Deputy Speaker, this is what leadership looks like, not turning away from hard conversations but embracing them with honesty and hope. It is about standing beside every Australian saying, you matter, your life matters and help is available. Together we are rewriting the story of mental health in this country, one of connection, care and courage. As we expand this network of free, high-quality services, Australians can turn to the Medicare Mental Health phone line or visit the Medicare Mental Health website to find the service that's right for them. This is what it means to govern with empathy, with purpose, and with a commitment to the well-being of every Australian. Because when we invest in mental health, we invest in the strength, the resilience and the humanity of our nation. Deputy Speaker, hope is the heartbeat of a healthy society, and through these investments, we are saying to every Australian, you are not alone, your story matters, and your future is worth fighting for. Thank you.
I thank the member and I call the clerk.
Next order. Further statements on the 50th anniversary of the Racial Discrimination Act.
Are there any statements? I give the call to the member for Forde.
Thank you, Deputy Speaker. I rise on the 50th anniversary of the anniversary of the Racial Discrimination Act, and think that it's a reflection on really how far we've come as a country. That it's been 50 years since that was put in place. I suppose from growing up with a name like Holzberger that even though I might look like a lot of the kids that I grew up with, just having a name can invite ridicule, teasing, bullying. And while I guess I took it in most cases in the sort of humour that it was intended, it didn't feel great, and it did make me feel excluded. And I can just begin to imagine what it must feel like for people in the community that might have, a different accent, different skin colour, and the brutality of that reality for people means that there is a role for government when it comes to passing laws on that. So, Deputy Speaker, I think this has been something 50 years ago that really shows that even though we've come a long way, there's still a lot to go. It reminds us that 50 years ago Australia was really coming out of that White Australia policy, and that it's sort of remarkable to think that at the age of 52 I was born, so close to that period in time, and it's been a great thing for Australia. Just before I conclude, that the one thing I've got to say, the one thing that I never thought I would appreciate so much being a federal member of parliament is going around to school assemblies, and particularly primary school assemblies. We're in Ford, a very multicultural electorate. To see all those little kids with different coloured faces and different shaped faces all looking up and singing the national anthem has got to be the most moving thing that I have experienced as a federal member of parliament. Now, multicultural society makes us stronger, and all the better for it.
I thank the member, and I give the call to the member for Menzies.
Thank you, Deputy Speaker. I rise today to recognise that it has been 50 years since the introduction of the Racial Discrimination Act, Australia's first anti-discrimination law. For most in this place, there would now be broad agreement that we need laws to prevent racial discrimination. However, the Racial Discrimination Act is like many progressive reforms that are now such fundamental parts of Australian society that they are sometimes taken for granted. Reforms like Medicare, like superannuation, they required sustained effort and a deep commitment to principle to get the legislation passed. The kind of effort and principle that only Labor governments show, in this case, the Whitlam Labor government. Like other important Labor government reforms, it was opposed by the then Liberal Country Party coalition. And like other important Labor government reforms, it has required us to show that same effort and commitment to principle to protect it from attacks, to weaken and undermine it by the coalition. The Act codified into Australian law our international obligations under the Convention on the Elimination of All Forms of Racial Discrimination, ratified in September 1975 by Australia. It showed a commitment to international law, to our international obligations, to being responsible members of the international community that continues to this day. The Act made racial discrimination unlawful in Australia through federal legislation. This historic legislation came only 2 years after the Whitlam government abolished the final vestiges of the White Australia policy. The Coalition Shadow Attorney-General, in speaking on the second reading speech, stated, with a myopathy that mirrors the current federal Liberal Party, that we in Australia have been singularly free of racial discrimination. Sadly, that wasn't true then, and it isn't true now. There is still racism of the overt and the covert kind, and the Racial Discrimination Act is just one tool to combat it, but it is a crucial one. To get to the specifics of the Act, it includes a general provision making racial discrimination unlawful and specific protections to prevent discrimination in areas including employment, the provision of goods, housing and access to public places. This means that when someone goes to purchase a product or a store or visit a restaurant or tries to access services like their local GP, they must be treated the same regardless of their race, ethnicity or national background. When someone applies for a job or applies for a promotion or asks for leave, they will not face discrimination under the provisions of this Act. But the Act goes further, preventing indirect discrimination where a person requires another to comply with a term or condition which is not reasonable and the requirement is discriminatory. It goes to that fundamental principle of the rule of law, that all people are equal under the law. Not surprisingly, the Act has a significant legacy. It influenced the states and territories to legislate their own anti-discrimination laws. Section 10 of the Act, which provides for rights and equality before the law, influenced the decision in Mabo and the Queen No. 1 to invalidate legislation which would have retrospectively abolished native title rights. Of course, the subsequent decision in Mabo No. 2 rejected the fiction of terra nullius in Australian law. But most importantly, the Act made clear to the community, to employers, to businesses and services that they must treat people the same, regardless of race, and that where this doesn't occur, there will be consequences. Now, vital to the administration of the Act is the Australian Human Rights Commission, who are responsible for receiving complaints and attempting to mediate them. The most common type of complaint received are those related to discrimination in the provision of goods and services, followed by discrimination in employment. The AHRC also play a vital role in educating the community about their obligations under the Act, as well as implementing the National Anti-Racism Strategy, commissioned by the Albanese Labor government in 2022. Now, it is not just the AHRC that plays that vital role within society of combating racism. There are also many organisations within my electorate of Menzies that play this vital role. We have the Migrant Information Centre in Box Hill, which supports migrants and refugees to settle in the community, that links them with essential services, that informs them of their rights and their responsibilities as members of the community, and also holds a number of functions reaching out to the broader community. We have AIMS, who deliver the Adult Migrant English program to ensure that recent migrants have a level of English that allows them to communicate with businesses, with their employers, that helps them settle successfully in Australia. But our local schools and kindergartens and child care centres, our businesses, they all play a role in combating racism. I'm lucky enough to visit a lot of schools around my electorate, and I know that they all have strong anti-racism strategies, that all the children from diverse backgrounds should, as much as possible, feel safe attending school, knowing that they won't face racism, that they won't face discrimination, because Menzies has a higher than average proportion of people born overseas, a higher than average proportion of people who speak English as a language, who speak another language other than English at home. And it's really important that all of our services, and especially those that support young people, are sending that message that racism is not acceptable under any circumstances. We also have some great local festivals that play an important role in building bridges and celebrating and sharing cultures in our local community. The weekend just passed, I was lucky to attend the Persian Fair at Box Hill Town Hall, which was organised by the House of Persia and the Australian Iranian Society of Victoria. And I was fortunate to be able to watch their amazing performances with dancing and music, and the food as well was really incredible, and I was very grateful to the community for being so welcoming, but also for providing the opportunity for members of the wider community to experience the richness and the colour of Iranian culture. Next year, we will have the Box Hill Chinese New Year Festival, which is one of the highlights of our local calendar, and one of the biggest Chinese New Year festivals in Melbourne. It attracts over 100,000 people, and it's a real staple of our calendar, and I was proud to advocate and secure an election commitment of $150,000 to support the Box Hill Chinese New Year Festival. We will also be holding the inaugural Manningham Chinese New Year Festival. It was held for the first time last year and was a huge success. So looking forward to seeing it back in the northern part of my electorate next year, and seeing how it benefits our local traders around Jackson Court and in Doncaster East. That as well we have been able to support with a federal election commitment of $50,000. Both of those events are run by the Asian Business Association of Whitehorse, who are very active in our community in running these local festivals and advocating for small businesses. Now, in 1995, the Racial Discrimination Act was strengthened by the Keating Labor government following a number of inquiries into racist violence in Australia, as well as in response to a recommendation of the Royal Commission into Aboriginal deaths in custody. One of the more debated amendments to the Act is Section 18C, which provides that it is unlawful for a person to do an act otherwise than in private if the act is in any way likely to if the act is in any way likely to reasonably offend insult, humiliate or intimidate another person or a group of people due to a person's race. Now, there are some in this place, some on the opposite side, who believe that people have a right to be bigots. That is something we in the Labor Party will never support. The Racial Discrimination Act is more important than ever. As much as we would like to believe that the arc of justice bends towards history, this is not something we can take for granted. Anti-immigration rallies organised by neo-Nazis have been held in our major cities. Foreign narratives and conspiracy theories spread on social media erode our trust in democracy, and conflicts abroad have tested our social cohesion here. The Labor Party will always stand up for modern, multicultural Australia. We are the party that enacted the Racial Discrimination Act. We are the party that acted to address apartheid, and we are the party that will always back modern and multicultural Australia. Thank you, Deputy Speaker.
I thank the member and I give the call to the member for Barton.
Thank you, Deputy Speaker. Today I rise to acknowledge and honour the 50th anniversary of the Racial Discrimination Act 1975. This is one of the most profound legislative markers in Australia's modern story, and a law that has shaped the lived experience of millions, including families.
Order. A division has been called for in the House. The proceedings are suspended to enable honourable members to attend the division. The proceedings will resume when the Chair of the Federation Chamber is resumed at the conclusion of the division or subsequent divisions. I give the call to the member for Barton in continuation.
Thank you, Deputy Speaker. And this is one of the most profound legislative markers in Australia's modern story, and a law that has shaped the lived experience of millions, including families like mine and the communities like Barton. The passage of the Racial Discrimination Act was not just legal reform, it was Australia declaring formally and finally that equality before the law is not optional, not conditional, not aspirational, but fundamental. Half a century on, we recognise that this Act continues to be a pillar of our democracy, our social cohesion and our identity as a nation that believes in fairness. Deputy Speaker, when I delivered my first speech in this place, I spoke about the journey of my life. People who, like so many migrants, arrived here with hope, humility and a fierce determination to build a much better life. And I spoke about growing up in my electorate, about the pride I feel with my Sri Lankan and Papua New Guinean heritage, raised by a Maltese and Italian family, and the pride I feel being Australian. I spoke about the lessons of my late grandfather, a man who taught me that service, kindness and dignity are the measure of a life well lived. What I did not get the chance to say, but wish to say today, is that the lives and mine would have been very different if not for the Racial Discrimination Act. When the Racial Discrimination Act passed this Parliament in 1975, it did something incredibly simple yet profoundly transformative. It recognised that everyone in this country is entitled to the same respect, the same safety and the same dignity regardless of race or background. That principle sits at the heart of the electorate of Barton. Now, Barton is one of the most multicultural communities in the nation. Our residents come from every continent, every faith tradition and every culture, and we are stronger because of this. And I'm proud to represent a community where diversity is not just tolerated or accepted, but absolutely celebrated as our greatest asset. I'm proud to represent a community where diversity is... But the truth is that for many decades in this country, people of colour, First Nations people and multicultural communities face systemic discrimination. It occurred in housing, in employment, in education and in access to services. Many still face it today. The Racial Discrimination Act was a promise to all of those communities that the law would stand with them, not against them. It was a promise that the lapses of our past, including the White Australia policy, exclusionary practices and harmful sways, would not define our future. It is a promise that we must continue to uphold. Deputy Speaker, over the last 50 years, this Act has changed lives. It has empowered people who face discrimination to seek justice. It has shaped policies and behaviours across both public and private sectors. It It has strengthened multiculturalism as a core Australian value. It has shown generations, including mine, that belonging is not something you must earn at the expense of your identity. Belonging is a right. In Barton, I see the legacy of this legislation every single day. I see it in the confidence of young people who grow up speaking 2 or 3 languages at home. I see it in the parents who know their children will be judged on their character, not the colour of their skin. I see it in the friendships in the local businesses, in community organisations and in faith groups that together form the social fabric of our community. But, Deputy Speaker, anniversaries are not only moments of celebration, they are moments of reflection. Because of the work of the Racial Discrimination Act is not finished. It cannot be finished while racism in any form still exists in this country. We know it persists. We see it in the rise of online abuse. We see it in misinformation campaigns targeting migrant communities. We see it in casual racism that still sits beneath the surface of national conversations. We see it in the prejudice experienced by our First Nations people, whose rights and voices must never be ignored. We see it in humiliating behaviour, in particular this week from Senator Hanson in the Senate, who has clearly said she has no respect for the people in this House, let alone the people of Islamic faith. We also see it in new forms, including algorithmic bias, discrimination in AI, and inequalities in data and technology. These are challenges the original drafters of this Act could never have imagined, yet they now fall on us to confront. It is our responsibility as parliamentarians and as Australian citizens to ensure the Racial Discrimination Act continues to evolve so it remains powerful, it remains relevant for the next 50 years. Deputy Speaker, as someone who's worked closely with communities through St Vincent's de Paul Society, I've seen the way discrimination, even subtle or systemic, compounds disadvantage. It limits pathways to employment, it affects health outcomes, it creates social isolation. It sends a message that some people are less valued. We are not simply recognising a historical achievement. We are recommitting ourselves to the vision of a nation where equality is real and not rhetorical. Deputy Speaker, the founding words of the Act are as relevant as it was in 1975. They say that racial discrimination is unlawful in any area of life. Those words must continue to guide us, especially in the era of global uncertainty, rising extremism and economic pressure. History has shown that in times of hardship, racism can resurface. It can be used by those who seek division. It can weaken the social cohesion that all Australians rely on. As leaders, it is our duty to push back clearly and firmly. Deputy Speaker, in my first speech, I spoke about the privilege of being the daughter and granddaughter of people who sacrificed so much so that I could stand in this chamber. I spoke about representing a community that embodies the best of multicultural Australia. I spoke about the responsibility I feel to fight for fairness, for justice, and for the dignity of every person in Barton. Those convictions are strengthened by the legacy of the Racial Discrimination Act. And as we mark the 50th anniversary, let us tribute the lawmakers who passed it, the activists who demanded it, and the communities who needed it. But let us also honour the next 50 years, the generations who will depend on us to defend it. The fight against racism is not a moment, it is absolutely a movement. It's not a single law, it is a lifelong effort. It's not the work of one parliament, it is the work of an entire nation that believes in fairness. Australia is at its best when we treat every person with respect. Australia is at its strongest when we cherish our diversity as a source of pride. Australia is at its most united when we stand up clearly and courageously against racism in all forms. The Racial Discrimination Act gave us the foundation. It is our task to build the future. And on behalf of the people of Barton, a community shaped by migration and strengthened by diversity, I am proud to stand today to honour the 50th anniversary of this landmark legislation. Thank you.
I thank the honourable member and I give the call to the member for Adelaide.
Thank you, Deputy Speaker, and can I congratulate the member for Barton for putting it so eloquently and so well, and it's just great to see some of these young people that are here today in our parliament. When I compare the parliament that I joined in 2004, and the faces all around us, how it's changed and how it's changed for the better is just incredible. And when I see members like the member for Barton and others, it gives me great joy that we've finally in this parliament are coming to age. We still have a long way to go, but we're just coming to that point where we are truly a reflection of our communities, and it's so important to ensure that we honour those and celebrate those things, just as it's important to honour and celebrate milestones in our political history. As the anniversary of the Racial Discrimination Act of 50 years ago, which was a cornerstone to our modern-day society of ensuring that everyone was treated equal under the law, even though that was always the case under our Constitution. This value added to the significant pieces of legislation in Australia's history, a cornerstone in our journey towards becoming a truly multicultural nation, but also a truly egalitarian nation as well. And the Landmark Act came into effect Friday, 31st of October 1975, under the Whitlam government of the time, the Labor Whitlam government. It was the first legislation of its kind in Australia to focus squarely on human rights and to prohibit discrimination on the basis of race. So what did that mean? That meant that even though we had a constitution, except that looked at all of us equally and fairly, unless you were of Aboriginal descent, of course. We know that it took many, many years to come up to the mark there, and we still have a long way to go. But what this meant is that under the law you could not be vilified. Under the law, under the human rights, squarely focusing this on human rights, and to prohibit discrimination on the basis of race. It embodied a principle that has long been part of our Australian spirit. Deputy Speaker, the Racial Discrimination Act gave life to Australia's commitment under the UN International Convention on the elimination of all forms of racial discrimination. It signalled a new direction for our nation, a future built on acceptance, inclusion and respect for all cultures. And this legislation, Deputy Speaker, protects people across Australia from unfair treatment based on race, colour, descent, national or ethnic origin in many areas of public life. Deputy Speaker, it also ensures equal footing and preserves fundamental freedoms. It goes further by prohibiting acts of insult, humiliation, vilification, actions that deny basic human rights. And in short, it guarantees equal enjoyment and exercise of those rights for all Australians. In other words, what we've seen, some pretty horrific things on our TV news and in our media on national days such as Anzac Day, and of course just recently, a couple of weeks ago, on Remembrance Day, certain groups that have great enjoyment of vilifying and ensuring that people are made to feel lesser than all of us, are areas where governments and police, etc., can take action because of this particular bill. Now, if you remove this bill from 50 years ago, there would not be much action that you could take against groups like that. So it is squarely one of our fundamental laws in this country that ensures that that equality that I spoke about and the rights of everyone to coexist within a respectful way. At the heart of the Act is Section 18C, which provides protection against racial vilification, and alongside it is Section 18D, which offers exemptions for actions done in good faith, such as artistic work, research, etc. And the pathway to legislating this, I suppose, is the Act, I suppose, wasn't easy to get through. It was a testament to determination and grit of then Senator Lionel Murphy as Attorney-General, who introduced the bill in the Senate, not once but 3 times. 3 times it was introduced, and it was rejected 3 times, or 3 times it was voted against. And you just, something that is mind-boggling if you think about it today. A Racial Discrimination Act to ensure that everyone's rights are protected, and there was people in this place that were voting against it. The debate was divided, but the Whitlam government understood that the bill was more than just another bill or more than just law. It was about social change, and we see the fruits of that social change today. And then a bit later, Attorney General Kep Eddenby said at the time, the bill will perform an important educative role. In addition, the introduction of legislation will furnish legal background on which to rest changes reflecting basic community attitudes. The fact that the racial discrimination is unlawful will make it easier for people to resist social pressures that result in discrimination. So Australian laws exist to express the values of a civilised society. The Whitlam government reflected the future and where we are today, and now the current values of Australia of today, a multicultural country that embraces diversity and is proud of it. And Deputy Speaker, when I think of our diggers that died in World War I in Gallipoli, right through World War II, the many theatres of war that we've engaged in, Afghanistan, Vietnam, it's all about the individual freedom, the ability to be free in a nation, in a vibrant democracy where everyone is treated equally regardless of race, religion, colour of their skin, etc. Deputy Speaker, going back to this 18C and this Act, an 18C which forms a very important part of this bill, as I said, it hasn't been without challenges. Section 18C, the core protection against racial vilification, came under threat not that long ago. In 2016, I think it was, when or maybe 2014, the then Attorney General of the Coalition introduced the bill proposing its repeal, and he argued that people have basically, that would have meant that people had rights to be bigots if that had gone through back then. And how could we allow that? How could we permit open racism and discrimination to creep back into our society? Imagine if that bill had passed. Australia would not be the country it is today. We would not be the country we are today. Migrant families could have been relegated to second-class citizenship, denied their fair life that they deserve. And if you think back, and I've made this statement in this place a couple of times, when we were negotiating mass migration in the late 40s, there was a mindset in this place that before the bills went through to be able to bring migrants in to basically fill labour shortages and to populate or perish, as we'd heard, the argument was that migrant workers should be paid less than Australian workers. And that was the argument that was taking place in this chamber back then. Thank God the unions and the Labor Party relentlessly disagreed to it. But could you imagine the country that we would be today had that gone through? Can you imagine what sort of country Australia would be today had that gone through? So you need people with foresight, like Mr Whitlam, Lionel Bowen, to ensure that we put acts into place that preserve those rights, that preserve dignity and preserve an equal society that ensures that everyone is treated fairly, which I said is under our Constitution. But you also have to ensure that there is that ability of vilification to creep in, which could creep in slowly but gradually, then becomes a mass vilification, and we could have an entire upheaval of our society. So that's why this law that we're discussing today from 50 years ago is worth celebrating, and it's worth honouring, because it's laws like this that give the direction of the country, change the country and benefit future generations, as we see today in a wonderful multicultural Australia that actually treats everyone fairly. We have good laws in place, regardless, as I said, of your religion, your ethnicity, your place of birth. We ensure that people are treated equally with the same opportunity and the same hopes for future that everyone has.
I thank the member for Adelaide and call the clerk.
Government Business, Order of the Day number 4, Annual Statement on Northern Australia, Ministerial Statement, Resumption of debate on the motion that the House take note of the document.
The question is that the document be noted, and I call the member for Leichhardt.
Thank you, Speaker. I rise today to speak on the statement made by the Minister for Northern Australia. My electorate, Leichhardt, is the perfect embodiment of Northern Australia, and while some will point to Townsville as the capital of the far north, they are wrong. It is in fact Cairns. But Cairns is just the gateway to a much broader and spectacular part of the world. And if you'll indulge me, Speaker, I would like to go on a little bit of a geography tour, a place I know that you know well, as I ran into you randomly one day at one of the local shopping centres as you were enjoying many of the delights that Cairns has to offer. So we'll start in Cairns. Cairns is a thriving metropolitan city. It is multicultural, it has many different industries, it is welcoming, it is beautiful. It is the home to the Reef Fleet and the Great Barrier Reef, the gateway to Green Island, Osprey, Lizard Island, Fitzroy Island, where I believe my daughter is right now celebrating schoolies. It is a truly magnificent place. We have over 128 different cultures that are celebrated en masse. Over 10,000 people went to the recent India Day festivals. Diwali was a huge celebration. We are multicultural, we are proud of it, and we pull together. We have a shipping industry. Over $250 million is run through our shipping repairs, including working on our naval boats. It is a truly beautiful place. It is also home to the Far North's only national sporting team, my beloved Cairns Taipans, who we wish were going better, but we can't have everything. If you spend a few days in Cairns, you might think, what else is on offer? So you'll start driving north. You'll get to the tourism hotspot, the destination that is Port Douglas, one of the most beautiful places on the planet. The golf course there, Palmer's Golf Course, the crocodile on the first hole, lurking in the water trap there. You just let the ball go if it's too close to the edge. It is one of the places that people put on their bucket list. Port Douglas is amazing. I would encourage everybody to get there as soon as possible. A little bit further on, we've got Mossman, home of the Mossman Gorge Cultural Centre, a world-renowned Indigenous cultural area. Mossman is currently transitioning away from sugarcane. They're having discussions about what their future looks like, and while this is a tough time for them, they are built of really strong stuff. There is a frontier attitude, a pioneering attitude that is part of the far north that I know will serve them greatly. If you leave Mossman, you've got to head out a bit further. Now we're at the gateway to Cape York. The gateway itself positions itself as Lakeland. Bananas. Some of the best bananas on the planet, as far as the eye can see. At Lakeland, you have a choice. Continue on straight, head up to Wujal Wujal, Cooktown and Hopevale, or take a left. Drift out to Cowan, Cowanyama, Pomperau, Weipa, Arakoon, Lockhart. We'll stay right for the moment. Once you get to Cooktown, a historical place. It used to be over 30,000 people lived in Cooktown during the gold rush. It is now down to about 3,500, but they are proud. They have a great tourism industry, a great fishing industry, a fantastic bowls club if you need a cold beer and a good feed at the end of the day. Close to Cooktown is Wujal Wujal, a beautiful, beautiful place nestled in the rainforest people. Wujal Wujal obviously suffered catastrophic effects through Cyclone Jasper, and everyone had to move out, but I'm pleased to say they're back. The sports hall has reopened, they're rebuilding their arts centre, that community is as strong as ever. To the other side of Cooktown is Hopevale, home of Noel Pearson, who has brought so much change, positive change, to Indigenous Australians. A town that butts well above its weight. It is strong, it is proud. Back down to Lakeland, we're going to head out to the Western Cape now. We'll start at Lockhart River. Tucked away, was actually on the Eastern Cape, you've got to go west first. It's a trick of the road. The PDR is one of those, well, look, it is a bucket list experience, the PDR, gets you right all the way up to Pajinka. But Lockhart River, home of 5 different clans, fantastic fishing, and some of the best art in the Cape. It is also where the American fighter pilots were based during World War II, and the rocks in the ocean carry the scars of the 50mm guns that were shot during target practice. Back down onto the PDR, out to Arakoon, fantastic art, fantastic people. I've spent many, many days there running basketball clinics for kids, bringing up shoes, spending time with Steve and Norman at the PCYC as they show their children to make good choices and they build the leaders of tomorrow. Weipa is a mining town. Bauxite, as far as the eye can see. But it is developing. It is now a town. There are almost more small businesses now in Weipa than there are miners. It is ready to take that next step. Just south of Weipa is Napranum. Beautiful little spot. They want to become the food bowl for Rio Tinto. It's a really great ambition. To the north, Marpoon. They are getting ready for cultural tourism when the cruise ships start arriving in the Western Cape next year. Down further south, we've got Kowanyama and Pomperau, the place of many waters. Great art, great fishing. And then finally up top, the NPA. The NPA is a home to a truly unique culture, Aboriginal land gifted to the Torres Strait Islanders. It is a place where the two cultures mix and merge and create something truly unique and beautiful. And as a great industry, there's possibly gas out there, and people drive all the way up to Bajinka, staying in Bamaga. And then, of course, Zenith-Keth, the Torres Strait, home of Eddie Kokomabo, and the multiple different islands. The only regional council with an international border. Councillor Chelsea sits there and ticks people off as they drift over from PNG for cultural ceremonies and for trade. It is the most northern part of Northern Australia. And the thing that all of these places have in common is the limitless potential. The potential of the people, the potential of the minerals, the potential of the tourism. It is all there at our fingertips. And it is great to hear Minister King speak of the potential and the opportunity that is presented to Northern Australia, not just my part of the world, but right the way across. The world is pivoting north. All roads are leading north. We're pivoting our international look towards the South Pacific. We are tailor-made for it. We are in the right place geographically. We have the right things minerally. We have the right space, and we have the right people. I'm proud to be a part of a government. I'm proud to be put here by the people of Leichhardt to try to snatch these opportunities, to become the renewable powerhouse that I know we can be. Some of the best silica in the world is located in Leichhardt. Silica, as some might know, is essential in the building of solar panels. There is opportunity for manufacturing there. The Indigenous Rangers know country backwards. They understand carbon capture and farming and have been doing it for tens of thousands of years. And in doing so, they're showing the way for new industries to evolve. Carbon capture, blue carbon, all of these storage using ancient knowledge. And there is a lot of space up there, a lot of space for carbon capture. The cultural and tourism part of it. We have something unique, something nowhere else in the world can talk about. The world's oldest living culture, 60,000 years. The art decorates the rocks. The language is still spoken in many of the small communities. And it breathes and it's real. Sit with the elders. They'll tell you the stories. They'll show you the dances. Last time I was in Mapoon, I ran into a group called Indigital, who are taking the stories and putting them into a Minecraft-style game so that you can live and walk the dreaming. The kids get to design the characters. It is a great community building exercise as the elders sit down with the young ones and tell them the story. It takes ancient knowledge and puts it in a 21st century context. And that's what the Far North is, an ancient and wild place ready to take on the 21st century in a way that not many other places are positioned to do so. I want to commend the Minister for working with Northern Australia, for understanding the challenges that we face, but for not turning her back on us. Sometimes when challenges present themselves, it can become too hard for people. They're not sure what to do, where to go. But through every challenge there is opportunity, and we have so much opportunity. We will carry Australia forward in the renewable transition with our critical minerals. We will show the world who we are through our cultural tourism, and we will protect and promote the mighty Daintree, the Great Barrier Reef and the wildness of Cape York. We will celebrate the unique culture of Zenith-Keth, whose elders are actually in this building today, meeting with us. It is my honour to represent Northern Australia. It is my honour to defend Northern Australia. And I am so proud to be here doing so with a government that believes in the opportunity that my region possesses. Thank you.
Thank the member for Leichhardt. That was magnificent. And I do understand that the member for Solomon is on his way, and so we're going to take a short recess and then I'll resume the chair. I call the member for Solomon.
Thank you, Deputy Speaker, and I do appreciate that short recess as I come from the other chamber. But it's an absolute privilege to be speaking in the Federation Chamber this afternoon around Northern Australia, something very close to my heart, obviously, representing the people of Darwin and Palmerston and Territorians in our federal parliament. And I was particularly proud of Territorians over the weekend when Cyclone Fina came through from the east, moving across the top end and now down to WA. But that was the day, Monday, when we started the clean-up, that there was the statements on Northern Australia. And I couldn't be here, and I appreciate the opportunity to make some comments now. Cyclone Fina and the damage and disruption created are indeed a timely reminder of the extra challenges faced by people and communities right across the north of Australia. It's very heartening to hear about the progress being made through the Northern Australian Action Plan's first annual progress report. To see that progress on the ground is important, and part of my job as a Special Envoy for Northern Australia. The work being done is strengthening an already resilient north, because people living in the north of Australia are generally resilient, but there's also providing many further opportunities for the developments of both industries and infrastructure, and I want to go through those in a little bit of detail. The work addressing critical issues such as housing availability in the north, enabling greater First Nations economic self-determination and progress. Progress is only made possible through collaboration. So it was good to hear from the Minister, the member for Brand, about the decision to extend the life of the NAIF, the Northern Australia Infrastructure Fund. That 10-year extension of the NAIF will mean that the NAIF can continue to invest in projects right across the north, well beyond the current investment deadline of June 30 next year, reassuring communities and stakeholders in the north, many of whom contributed to the review. So the short story is that the NAIF has been topped up and is here to stay. And long may it be topped up and long may it stay. The Albanese Labor government has worked to ensure that the NAIF is supporting projects that deliver tangible benefits to Northern Australian communities. So far, $4.32 billion with a B to finance infrastructure development across the north of Australia. 14 projects in Queensland, 10 in WA and 8 so far in the NT. The NAIF was designed to address a lack of private investment that sometimes we see in the north, although more enabling infrastructure is drawing more private investment. But it is understood by people living in the north that things cost more, There are higher risks associated because of our distance from the main population capitals in the south, the remoteness of many of these areas of the north that have abundant resources, the climate that we quite love, but the vagaries of tropical weather systems, as we saw on the weekend, also make it an interesting place, an exciting place to live, but also carries with it some challenges that the NAIF was set up to help with. Growing financial ecosystems throughout the north, responsible investment through the NAIF on those long-term development goals. The north is absolutely central and essential to our nation's future prosperity and, of course, our security. So the reference group for Indigenous First Nations people across Northern Australia, I want to also give a shout out to. It is led, the IRG, the Indigenous Reference Group, by the esteemed chair, Professor Martin Nakata. And I was also delighted to spend some time with an IRG member, Alinta Maguire, in Darwin recently with my colleague, the Assistant Minister for Northern Australia, Senator Nita Green. Great conversation, but I want to publicly thank also past members of the Indigenous Reference Group, including Darwin fella and good bloke Jerome Cabillo, Tara Craigie, Peter Jeffries, Gillian Mailman, and the former chair, Colin Saltmere, for their contribution to the Indigenous Reference Group and support for Northern Australia. And I want to just make a quick comment about that. The financing that's involved with the NAIF is vital, but it's also vital that we're doing all the things that we're doing to get workforce and to provide pathways for not just First Nations people, but non-Indigenous people as well in the Northern Territory, WA and Queensland, that have been underemployed, and to build our own. That's what a lot of our policies are about in terms of fee-free TAFE and any work that we can do to have a pipeline of Northern Australians to do all the work that we need done in the north. They're the workers and the workforce that we can depend on the most, obviously, so that's also important work. Important work also done by the officers, so I want to give them a shout out as well to the NAIF office and to the Office of Northern Australia. They're providing great support, and long may it continue. Obviously with the extension of the NAIF, that's assured, but the Office of Northern Australia, they do great work to support industry, to support communities, including remote First Nations communities who have a deep and ancient connection to their country, but also want to have a future for their children and want to have their kids on a pathway to a sustainable future and a future of dignity. And if there's one thing about the North that all honourable members should know and would know, it's very rich in resources, whether it be sun, wind, gas, iron ore, but those important critical minerals. Those critical minerals are really crucial to our nation's future security and our engagement with our neighbours in the Indo-Pacific. And the development of Northern Australia is for all those reasons, and for the fact that we are a united country that wants the best for every Australian, including people living in the north. That is why the north is such a priority for our Albanese Labor government. We are committed to realising the full potential of the region, because the potential was often talked about, but the action to turn that potential into opportunity and to futures is what's really important, because a strong north means a strong Australia. So just quickly, the action plan 24 to 29 and the annual progress report shows that we are progressing those priorities, activating the northern economy. Part of the NAIF has been earmarked for $500 million for projects under the government's critical mineral strategy. We are putting substantial resources into the Arafura Nolans rare earths integrated mine and processing facility near Alice Springs. And that's what a future made in Australia is all about, not just digging stuff up, but then doing the processing. And what that means is great jobs. What that means is logistic hubs up through central Australia that are going to support a whole range of industries into the future, making us more resilient. And that is important for our sovereignty. The Australian nation has a bright future because, in part, of Northern Australians and what we can bring to the table, and we thank the federal government for that support.
I thank the member for Solomon.
I move the debate be adjourned and the resumption of debate be made in order of the day for the next sitting.
The question is that debate be adjourned and the resumption of debate be made in order of the day for the next sitting. All those of the opinion say aye. Aye. Against say no. I think the ayes have it.
I move that the Federation Chamber do now adjourn.
I second the motion.
The question is that the motion be agreed to. All those of that opinion say aye. Of the contrary, no. I think the ayes have it. The Federation Chamber stands adjourned until 9:30 a.m. tomorrow morning. Thank you very much.